you have headsets that are available. Do not hesitate to get them in case you need them. Thank you very much. I would like to make this declaration on behalf of the organizing committee of this Dakar Forum. Dr. Ibrahim Massi, Honorable Minister of Health and Public Hygiene of Senegal, Dr. Amadou Lamine Samate, Honorable Minister of Health of the Gambia, Dr. Augusto Gomez, Minister of Health of Guinea-Bissau, Mrs. Moha Mariama Al-Hassan, Ambassador of Niger in Senegal, Honorable Martha C. Morris, Deputy Minister of Health of Liberia, Kajete Aliye, Deputy Minister of Finance of Sierra Leone, Dr. Godwin Tadonda, Director of Public Health of Nigeria, Dr. Abdullahi Kaba, Senior Advisor to the Minister of Health of Guinea-Conakry, Mr. the Director General of CDC Africa, the committee, the organizing committee of this forum, put in place by the Minister of Health and Public Hygiene of Senegal, welcomes you and thanks all those who contributed to the holding of this event. We pay tribute to the head of state of Senegal, who agreed to host this event, to the Prime Minister and to the entire government for facilitating the work of the organizing committee. We thank CDC Africa and all its partners for providing technical and financial support for this forum. We also thank the members of the various committees, particularly the Scientific Committee and its chair, Professor Tanda Haje. We hope we are very thankful to them. We hope that the results of these days of reflection and commitment will be translated into concrete action by the authorities who have already set the tone by mobilizing to hold this meeting. We would like to thank the members of the press, the protocol services, the interpreters, the event agency, and the SICAD staff for everything they have done for the success of this forum. Thank you for your kind attention. Thank you, each and all. Dr. Sambok Kaursar deserves more claps of hand. Thank you for your encouragement. Now that we've set the scene and thank the people who allowed us, enabled us to be here. So I would like to call upon Dr. Richard Miligo, who is the lead director of the programmatic program at Gavi. So please welcome him. Gilles Fanino for UNICEF West and Central Africa. I also call upon Dr. Amadou Lamine Samate, Minister of Health of the Gambia. A clap for them, please. Dr. Augusto Gomes, Minister of Health of Guinea-Bissau. Now, with a pleasure and honor, His Excellency Dr. Jean Kassea, Director General of Africa CDC, and His Excellency Honorable Minister Dr. Ibrahim Massi, Minister of Health and public hygiene of Senegal. Excellencies, honorable ministers, welcome. And to start this series of address, let me invite Dr. Richard Miligao to take the floor for his address of this morning. This Dr. Miligao is the main director of the engagement, programmatic engagement at Gavi.
Merci infiniment, Madame la modératrice.
Thank you very much, Madam Moderator, Your Excellencies, Ministries and Ministers of Health, Excellencies, representatives of Ministries of Economy and Finance,
le directeur général de CDC Afrique,
Excellence, Regional Director of CDC, Africa CDC,
pour l'Afrique de l'Ouest,
the representative of UNICEF for West and Central Africa. Ladies and gentlemen, all protocols observed, good morning. It is an honor for Gavi to participate in this high-level regional forum on immunization in West Africa. I bring you warm greetings from our Chief Executive, Dr. Sanya Nishtar, who regrets that she was unable to be here with us today due to scheduling conflicts. First and foremost, I would like to warmly thank the government of Senegal, as well as Africa CDC, for organizing this important event and for bringing together governments and public health leaders in West Africa at a challenging economic time when budget constraints threaten progress on immunization. This forum is an opportunity for us to reaffirm Gavi's commitment to supporting African countries, particularly those in the West African sub-region, in achieving their vaccination goals. Equitable access to vaccines and immunization is essential to strengthening the resilience of health systems in the face of future health crises. And as we all know, the question is not one of if they will come, but rather when they will come. Climate change, population growth, and conflicts unfortunately make this reality inevitable. Between the year 2000 and 2020, Gavi supported the vaccination of over 1 billion children, thus helping to save more than 17 lives. In our next strategic phase, covering 2026 to 2030, we aim to vaccinate an additional 1 billion children, with African countries' leadership at the heart of this ambition. Our collective security depends on our ability to anticipate, innovate, and collaborate. By strengthening local vaccine production, mobilizing national resources, and working together through regional mechanisms such as pooled procurement, cross-border collaboration, and sharing of best practices, we can ensure that no one, no country, no child is left behind. As such, Gavi is proud to have launched the African Vaccine Manufacturing Accelerator, known as AVMA, a pioneering initiative designed to respond to the African Union's call to produce 60% of the vaccines needed by our continent by 2040. Today, as we all know, and we've been discussing these past 2 days, Africa accounts for less than 1% of global vaccine production, even though it is home to 20% of the world's population. This imbalance jeopardizes the continent's resilience to pandemics. AVMA thus aims to support local manufacturing in Africa by de-risking investments for manufacturers, their financial partners, and international donors. By 2035, AVMA aims to support the purchase of at least 800 million doses of vaccines produced in Africa by at least 4 manufacturers using 3 different technology platforms. By adopting these principles, we are helping to build a more cohesive, efficient, and truly country-led global health architecture. Excellencies, dear Minister, Honorable Minister, Directors of Africa CDC, please allow me to share some thoughts on our own organizational transformation led by our Chief Executive Director, Dr. Sanya Nisha, through a program we call Gavi Leap. Gavi Leap is an ambitious reform of the Vaccine Alliance Secretariat based on 4 core principles. The first principle consists in putting countries first and at the heart of our interventions. In order to be country-led, global health needs to provide the countries with the required abilities to take full grasp of their health. Gavi's model plans for a progressive model in terms of immunization so that countries can increase their GDP and reach self-funding. This model should be replicated across health security architecture throughout the world. The second important point is what we call limited mandates. We've seen that fragmentation is at the heart of focus. Gavi remains focused on key abilities, namely the increase of markets, innovative approaches to funding to guarantee that more lives are saved. In this new architecture that we're imagining, each institution should focus on competitive advantages. The third axis of Gavi Leap is what we call the limited lifespan of our different institutions. One of the shortcomings of the current architecture resides in the absence of time-limited clauses. Gavi is no exception. Although we sincerely aspire to become obsolete, there is no specific timeline to compel us to do so. Setting clear deadlines to focus on producing global public goods while transferring operational responsibilities to countries and institutions would allow to maintain focus, underscore the urgency of the mission, and tangibly encourage country sovereignty. By aligning our efforts on these principles, we can build a more integrated, responsive, and truly country-led global architecture. Gavi stands ready to fully play this role of transformation, and we invite all our partners to join us in this collective leap forward to global health. Thank you.
Merci beaucoup, Dr. Richard Mirigo.
Thank you very much, Dr. Richard Migo. I would like to remind one and all that you are in charge of programmatic engagement within Africa CDC's Gavi. Thank you very much for these important points and for reiterating your institution's commitment to changing global health in Africa. We are now going to turn to Mr. Gilles Fanigno, Regional Director at UNICEF for West and Central Africa.
Excellence, Monsieur le ministre de la Santé
Excellency,
et de l'hygiène publique du Sénégal,
Minister of Health and Public
Excellence,
Hygiene of Senegal,
Monsieur le Directeur général de Africa
Excellency,
CDC, Excellence,
Executive
Monsieur
Director of
le
Africa
ministre de la
CDC,
Santé,
His
la
Excellency,
Gambie,
Minister of Health of
Excellence, Monsieur le
Gambia,
ministre de la Santé, la
Excellency,
Guinée-Bissau,
Minister of Health of
Monsieur
Guinea-Bissau,
le responsable de Gavi,
dear Gavi representative,
Excellence, Messieurs les ambassadeurs, distingués invités, partenaires et
Excellencies,
collègues.
ambassadors, distinguished
Je voudrais
guests,
commencer
partners, and
par
colleagues.
dire un sincère merci au
I
gouvernement du
would like to
Sénégal
start by
et de
extending our
l'Africa
deepest
CDC
gratitude to
d'avoir
the
confié
government
ce
of
forum
Senegal
régional de
and
haut
Africa
niveau.
CDC for organizing this
Ce geste
high-level
fort montre un
regional
engagement
forum.
commun à faire de la vaccination
This is a
une
testimony to the
priorité,
common
y compris
commitment
sur le plan politique.
to increasing
Je voudrais
immunization,
également
namely
saluer
on the
les autorités
political
des 14
front.
autres
I
pays
would like
d'Afrique de
to
l'Ouest
also
ici
commend
représentés.
the presence of the
Leur présence
14
montre
other West
l'engagement
African
collectif
countries present
en
here
faveur
today.
du financement durable
Everyone's presence
de la
here
vaccination,
shows
pilier stratégique des
the deep
interventions de
commitment
santé
to the
publique.
transformation of public health.
La vaccination a permis de
Immunization
sauver des
has
millions
allowed to save millions
d'enfants
of
et
children.
demeure un droit
It
fondamental
remains
pour
a
chaque enfant,
fundamental right
pour
for
tous les
each
enfants.
child,
Je
for
voudrais
all
noter également le
children.
rôle déterminant de
I would
Africa
also
CDC,
like to
le rôle
highlight the
déterminant de
determining
Gavi,
role of Africa
ainsi que
CDC,
l'ensemble des
of
partenaires qui ont
Gavi,
contribué à
as
la
well as all the
réalisation
partners who have
et à la
contributed
tenue de ce
to
forum.
organizing
Notre
this
vision
meeting.
commune a permis une
Your
dynamique
joint
régionale
vision
autour
has
de la
allowed for
souveraineté
a regional
sanitaire et autour de
dynamic
l'innovation.
commitment around
Gavi en
health,
particulier
sovereignty, and innovation.
joue un rôle
Gavi,
clé
in
dans le
particular,
renforcement de la
plays a
vaccination en
key
Afrique
role
avec
in
une
strengthening
vision
immunization across
ambitieuse.
Africa through
Soutenir la
ambitious
souveraineté des pays
vision,
africains,
supporting
encourager la recherche,
African
encourager
countries' sovereignty,
l'innovation et appuyer la
promoting
production locale de
research,
vaccins.
and
Ce
supporting
forum nous
local
permet de
vaccine
réaffirmer
manufacturing.
l'importance du financement
This
durable,
forum allows us to
non seulement pour la
reaffirm the importance
vaccination et les
of
soins de santé primaire,
sustainable
mais
development
aussi pour
for
le renforcement des
immunization, primary
systèmes
health
de
care,
santé
and the
publique dans la
strengthening
région
of public
afin qu'ils soient plus
health
résilients,
bodies across
afin
the
qu'ils soient
region
plus
for more
équitables, capables
resilience,
de
equity,
répondre
and
efficacement aux
capacity
crises sanitaires.
to tackle health
Cela est
crises,
pleinement aligné avec les priorités de l'UNICEF,
fully aligning with
particulièrement les
UNICEF's
priorités de
priorities,
l'UNICEF
more
en Afrique de
specifically
l'Ouest et du
in
Centre.
West and Central Africa.
Il est essentiel de garantir la
It is
disponibilité
key
continue
to
des vaccins
guarantee
et d'élargir
a
l'accès
full
aux services de
availability of
vaccination,
vaccines across
en
Africa,
particulier pour les enfants
guaranteeing
zéro dose,
access
dans le
to
contexte
vaccine
à
infrastructure, and
accès limité pour
especially in
certains
zero
pays
dose
de la région.
cases, which is quite limiting
Nous
across the
appuyons
region.
sans réserve l'appel à
We
renforcer le
are
financement public
unfaltering
dédié à la
in
vaccination,
supporting
porter
initiatives
le plaidoyer
dedicated
des
to
chefs d'État.
immunization, in
Cet engagement doit aller de
supporting
pair avec une
advocacy,
attention
and this
particulière
commitment is
portée
fully
à la qualité des
aligned
dépenses
with
afin d'assurer un
principles
impact
of
réel et
quality
durable sur la santé,
expenditures in
notamment la
order
santé
to
des
guarantee
enfants.
efficient
L'UNICEF
investment in health.
réaffirme son engagement et son
UNICEF
soutien
would like to
indéfectible
reaffirm
envers le
its
communiqué
commitment
élaboré lors du forum
and
de
unwavering
ce dernier
support
jour et se réjouit
to
de la
all
tenue
initiatives mentioned
prochaine du
this
sommet de la
week
CEDEAO avec
and
l'espoir que
to
ce
the
texte y
next
sera
forum
adopté.
organized by
Le besoin
ECOWAS.
de financement supplémentaire pour
The
la vaccination des
need for
enfants
more funding
reste
for
une
children's
priorité
vaccination
urgente. Aujourd'hui,
remains
dans notre région de
an
l'Afrique de
urgent
l'Ouest,
priority.
on compte plus de
Today in West
3,6
Africa,
millions
we
d'enfants
see over
sous-vaccinés,
3.7
dont plus de
millions
2,8
of
millions de ceux
under-vaccinated
qui n'ont
children,
jamais été en contact
including
avec des services de vaccination
2.8
de routine.
million children that are
Dans ceux qu'on
zero
appelle zéro
dose
dose.
cases.
Dans le contexte fiscal actuel,
Looking at
les
the
pays de
current
notre région font
tax
face à des
context,
défis pour
countries of our
mobiliser leurs
region are
contreparties
facing
dans le
great
financement de la
challenges in
vaccination.
mobilizing
Nous devons
funding
continuer à
for
les appuyer à la
immunization.
mise
We
en
need
place de
to
stratégies de financement
continue
solides,
supporting them
de
in
mécanismes
implementing
innovants, y compris
stern
des
and
mécanismes qui tiennent
robust
compte
funding
de la
mechanisms,
restructuration de la
namely
dette.
taking into account
Pour que
debt
plus
restructuring.
d'enfants soient vaccinés,
In order for more
mobiliser
children to be
plus de
vaccinated
financement à
and
lui
to
seul ne
mobilize
suffit pas,
more
nous le
funding,
savons.
we know that we need to do more. We should also continue thinking about how to better spend quality expenditures. In this regard, I would like to make two suggestions. First and foremost, we need to invest in primary health systems, other systems. We need to invest in community health workers, as well as in the implementation of routine immunization campaigns. Secondly, we need to address bottlenecks in budgetary expenditures. A study supported by UNICEF has shown that in some countries, payments for vaccinations or immunization can sometimes take up to a year. Over a dozen countries have established partnerships between the ministries through their ministries of finance and health, and such partnerships should be strengthened. Finally, UNICEF supports the implementation of the regional roadmap for regional funding of vaccines and manufacturing of vaccines. We're supporting this roadmap and are committed to be an active partner in its monitoring and implementation. Together, we can build a future where each child in each of our region's countries can have access to vital vaccines. Thank you very much for your kind attention.
Grand merci, Monsieur Gilles Faninou. Je rappelle que
Thank you, Mr. Gilles Faninou. You are the Regional Director of UNICEF for West and Central Africa. Thank you very much for the items you raised, in particular the importance of investing in human resources and strengthening the funding processes and the assessment of the roadmap, immunization roadmap. Now, I would like to invite on the podium Dr. Amadou Lamine Samate, Minister of Health of the Gambia. A clap for him, please.
Alors, il s'agit plutôt du docteur Augusto Gomez, ministre de la Santé et de la Guinée-Bissau.
Well, this is rather Dr. Augusto Gomez, Minister of Health of Guinea-Bissau. Oh, sorry, that is my emotion. So, yes, it is indeed Dr. Samake, Minister of Health of the Gambia. Dr. Samate, over to you.
Madam Moderator, the Honorable Minister of Health of the Republic of Senegal, Dr. Ibrahim Assi, the Honorable Minister of Guinea-Bissau, Dr. Gomez, my good brothers, other colleagues representing various countries here present, the representative of Gavi, representative of UNICEF, my very good brother who made this possible in collaboration with Senegal, the DG of Africa, CDC, the very passionate Dr. Jean Cassier, officials from the Africa CDC, officials from other health organizations here present, officials from the government of Senegal, other well-wishers, CSOs, and people who are here because they are interested in the welfare of the people of our region. I am honored once again to stand in front of you to participate in this very, very important forum on immunization in our region. Immunization is a time-tested strategy in dealing with the health of our people. It has come to the forefront more and more over the past years because it's a strategy that is seen to work. Its importance cannot be overemphasized. We all know preventable diseases, the challenges when it comes to cross-border control of these diseases. Our closely knit societies in the region certainly make it very important for us to come together to review our strategies and to look at the modalities of ensuring that we work collectively. In as much as this is important for our sub-region, but it is much more important between Gambia, Senegal, and Guinea-Bissau, and for reasons some of you already know. Our countries are typically small. That means quite a lot of our people live within very few kilometers from the borders. And typically people crisscross between the three countries every hour or every minute. So it is important that we collaborate and with the rest of the West African sub-region. Quite a lot of times, sequencing of pathogens in these countries actually indicate that we virtually have the same strengths. So that shows the importance of collaboration in the work we do. In the Gambia, the EPI was established in 1979 after primary healthcare was adopted, and we started with 6 traditional antigens targeting tuberculosis, diphtheria, pertussis, tetanus, measles, polio, and yellow fever. We are proud to say that our current immunization program is using 14 antigens against vaccine-preventable diseases. Immunization is one of the modern medicine's greatest success stories, and it has proven to be the most cost-effective public health program, saving governments investments on curative care. Time and again, the international community endorsed the value of vaccines and immunization to prevent and control infectious diseases, cancers, and other chronic illnesses. The Gambia made a lot of progress on its immunization program by contributing to the eradication of diseases like smallpox, attaining a polio-free status, elimination of neonatal tetanus, reduction in vaccine-preventable diseases like pneumococcal and meningococcal diseases, diarrheal diseases associated with rotaviruses, and the absence of diphtheria and pertussis cases. All this coupled with sustaining high immunization coverage, which currently stands at over 80% for bad doses, and a significant reduction in infant mortality. The government is committed to sustaining these gains made on immunization over the decades with the highest level of political commitment, increased government contributions to financing immunization through purchase of vaccines and timely payments of counterpart funding. As a country, we are working with our partners like Gavi, the WHO, UNICEF, PAT, and others to ensure access to immunization services is increased by putting up measures to reach every zero-dose child in the country. Some of the innovative ways we have put in place to attain this is by constructing more health posts to bring immunization services closer to the population, especially for people living in hard-to-reach areas. We also recently launched the Drive initiative and provided tricycles to community members to ensure last-mile delivery of vaccines and other basic health commodities to the population. One important modification we've also done, which is a very big plus, is innovative immunization timing. We have worked with partners to ensure that the urban centers where immunization rates are low and quite a lot of the women who carry their children for immunization services are either on the market, selling their produce, or in the kitchens cooking, or in the offices working. We devised a strategy whereby these children will be immunized over the weekends or in the evenings after the close of official working hours, and this is already yielding dividends. We also believe that integration of primary healthcare and strengthening our communities is one of the best and most appropriate ways to achieve universal health coverage, which is why routine immunization is fully integrated into our primary healthcare services, where community health workers serve as advocates for utilization of the EPI services. We also have systems in place that ensure vaccines are administered routinely at health facilities from primary to tertiary levels. These are strengthened by supplementary immunization activities like mass vaccination campaigns and periodic intensification of routine immunization. As we speak, the country will start a nationwide measles rubella campaign for children. These are done with the full engagement of community members to ensure they take ownership and be in the forefront for successful campaigns and better coverage outcomes, reaching as many eligible children as possible. Our ministry works in close collaboration with the civil society organizations and conduct regular training for immunization service providers. In addition, we integrated COVID-19 vaccination with routine immunization services as part of the measures geared towards saving lives and protecting people's health by increasing equitable and sustainable use of vaccines. We are all aware that domestic financing is an integral part of strengthening immunization services at national level, which is why we are supporting initiatives like the Gavi Leap, which is empowering countries to identify their own needs and pull resources together for financing immunization. And at this juncture, we are happy to say that we are some of the biggest supporters of the Gavi Leap, in the sense that it puts countries first, and the country priorities are what will be taken on board. Too often than not, we get the prioritization done by partner agencies, which sometimes do not align with the country priorities. And we are happy that this is coming to an end, and Gavi, in their new strategies, are putting countries first. That means we determine our priorities, and Gavi follows suit. The need for generating our own local data and using it to guide our strategies and intervention is also key, and we're working tirelessly towards this by ensuring we use sustainable, affordable, and efficient data systems like the DHIS2, linking with our national HMIS. The Gambia has also led a lot of research work, mainly at the Medical Research Council at the London School of Hygiene and Tropical Medicine, and the outcomes of these studies led to global initiatives like the production of the Haemophilus influenza type B vaccine. These gains were made as a result of the cordial working relationships between our existing regional structures and our communities. We will continue to work with scientific bodies and academia to contribute to more innovative ways of improving and strengthening immunization services. As I close, I wish to use the opportunity to thank my brother, Honorable C, for his guidance, for his leadership, and for organizing this conference so that we talk about this very important issue. And I equally thank the DG of Africa CDC for all the good work, the sleepless nights, all the efforts he's putting in place to ensure collectively with all of us that the health of our people is taken care of. I thank you very much for your kind attention.
Very much. Thank you very much, Dr. Hamadou Lamine Samate. My apologies again. Thank you for highlighting the situation and the progress is made in Gambia, and especially the strong ties between Senegal, the Gambia, and Guinea-Bissau. That actually leads me to the next speaker, Dr. Augusto Gomes, ministre de la Santé de la Guinée-Bissau. Dr. Gomes,
Now, please welcome Dr. Augusto Gomes, the Minister of Health of Guinea-Bissau.
Excellence, Monsieur le ministre des Génies publics du Sénégal, mon frère
Excellency,
Ibrahim Sy, Excellence,
Minister of
ministre de la
Health
Santé
and Public Hygiene of
de la
Senegal, Dr.
Gambie,
Ibrahim Sy,
cher frère
Excellency,
Amadou
Minister of
Samaté,
Health of Gambia, of the Gambia,
Excellence,
dear brother
directeur
Dr.
général
Amadou Lamine Samate,
de l'Afrique CDC,
Excellency, General Director
cher
of Africa
frère,
CDC,
cher frère Jean Cassé,
dear brother Jean Cassé,
Excellence, Monsieur le représentant
His
de
Excellency,
Gavi,
representative
Excellence, Monsieur le
of
représentant de l'UNICEF,
Gavi, His Excellency,
cher frère,
representative of
vice-ministre
UNICEF,
de la Santé,
dear brother
vice-ministre des Finances ici présent,
Vice Ministers of Health,
Excellence,
dear
officielle
brothers Vice Ministers
ici
present,
présente,
dear
Mesdames
brothers,
et Messieurs,
ladies and gentlemen,
permettez-moi
please allow me
de vous dire
to
bonjour, de Bissau,
greet you all,
de vous transmettre
extend greetings from
les chaleureuses
Bissau,
salutations
and to
de Son
extend
Excellence,
warm
le
greetings
président de la
from His
République de la
Excellency,
Guinée-Bissau,
the President of the
Général
Republic of
Omar
Guinea-Bissau,
Sissoko Embalo,
General Omar Sissoko
de Son
Embalo,
Excellence, le Premier ministre,
as well as greetings
Ibrahima
from
Kamara,
Ibrahim Kamara,
du
Prime
peuple de la
Minister.
Guinée-Bissau, de
Finally,
son gouvernement.
greetings from the people of Guinea-Bissau and their government.
Permettez-moi
Please allow
de,
me,
à travers de mon frère, ministre de la Santé et de
to
l'Hygiène publique, vous transmettre
transmit
et
through my
féliciter
brother, the Minister of Health and Public Hygiene of
le
Senegal,
pèlerinage
congratulations
du président Bassirou Diomaye et de
to
son
the
Premier
President
ministre
of the Republic,
Sonko
His
de
Excellency
cet important
Bassirou
forum
Diomaye Diakhar Faye,
sur
and
la
the Prime
vaccination
Minister Ousmane
dans
Sonko
nos États de l'Afrique de l'Ouest.
for the organization of this
La
highly
Guinée-Bissau
important
d'aujourd'hui
high-level
choisi
regional forum on immunization in
d'être
West
un
Africa.
pays
Guinea-Bissau
présente,
decided
actif
to be present,
et proactif dans
to
le
be
concert
active,
des nations.
and to be
Sous la leadership
proactive
de
in
Son
this
Excellence,
endeavor
le Président de
under
la
the
République,
leadership of
Général
His
Omar
Excellency,
Sissoko Embalo.
the President of the Republic, Omar Sissoko Embalo.
Permettez-moi encore une fois
Please allow me
de lire
to
mon discours
also
à cet
read
important
my
événement
speech
en
for
portugais,
this very
la langue
important
officielle
event
de
in
mon
Portuguese, the official language of my country.
est com honra,
It
prazer
is with
e
honor,
sentido de
pleasure,
responsabilidade
and a sense
que me
of
dirijo
responsibility
a esta
that
augusta
I address
Assembleia
this August
reunida
Assembly
em
gathered
Dakar,
here in
Senegal,
Dakar, Senegal,
o país de
the
Teranga,
country of Teranga,
para
Senegalese hospitality,
propósito que
for
transcende
a
as
purpose
fronteiras,
that transcends borders,
garantir que
ensuring that
cada criança,
every child,
cada mulher
every woman and every man in West Africa has access to safe, efficient, and affordable vaccines. Our region has made important strides in the fight against preventable diseases. However, the COVID-19 pandemic has revealed important weaknesses in our national health systems and in our capacity to manufacture and distribute vaccines. We have learned the hard way that over-reliance on vaccine imports makes us vulnerable, and that equity in access to vaccines is not only a matter of public health, but also of sovereignty and social justice. Today, this high-level regional forum is more than a technical meeting. It is a call for collective action. We need to invest in local vaccine production in our sub-regional and regional community in Africa to strengthen cold chains, improve distribution logistics, and, above all, reinforce our population's confidence in vaccination. Ladies and gentlemen, vaccination is not just a medical measure. It is a social pact. Each dose administered is an act of community protection, a shield against pain and loss of life, and a step towards a healthier and more productive future. Therefore, the time has come to seal our unwavering commitment to the following: increasing vaccination coverage in all countries of the sub-region, leaving no one behind. No country, no woman, no man, no child. It is also time to seal our unwavering commitment to mobilize sustainable financing to ensure that vaccination is continuous and resilient to crises, to invest in local vaccine production, reducing vulnerability to global crises, and it is time to commit to strengthening health systems so that vaccination is continuous even in times of emergency. We should promote regional cooperation for sharing resources, knowledge, and innovation. We should reiterate our commitment to promote regional cooperation for sharing resources, knowledge, and innovation, as I've said. And finally, promoting public confidence by combating misinformation with transparency and science. Ladies and gentlemen, West Africa has a history of overcoming adversity. We have faced devastating epidemics, and with unity and determination, we have managed to protect millions of human lives. Today, we have the opportunity to draw on these powerful experiences to transform our current reality and become a region where immunization is universal, sustainable, and led by Africans. Ladies and gentlemen, let us make this high-level forum in Dakar a milestone where declarations take shape and concrete plans translate into clear goals and lead to firm commitments. The future of our collective health depends on the decisions we make now and here in Dakar. May this forum be the turning point where we stop merely reacting to emergencies and start preventing them with strategic vision. Together, we can transform immunization into an act of sovereignty, solidarity, and hope for our entire population. Thank you very much.
Merci beaucoup, Excellence Dr.
Thank you very much, His Excellency Dr. Augusto Gomes, Minister of Health of Guinea-Bissau. Thank you for reminding us all of the importance of health sovereignty and what it will require in Guinea-Bissau. Ladies and gentlemen, let us now welcome His Excellency Dr. Jean Kaseya, Executive Director of Africa CDC, for their speech.
Merci beaucoup, Madame Raissa.
Thank you very much, Madam Raissa. I understand now that you are a key voice in many of the prominent events in West Africa. Excellencies, Mr. the Minister of Health of Senegal, the Gambia, and Guinea-Bissau, the deputy ministers are present in this room. The regional director of UNICEF West and Central Africa, and my brother, the director Richard Miligo from Gavi. I understand that there are other partners, colleagues, and representatives of countries. There are 14 countries represented, and also command this ministerial meeting for big success in a context where we have many meetings at many other level, but West African countries can come together to discuss about a key issue or problematic for our survival. I would be ungrateful if I didn't thank Mr. Minister, His Excellency President of the Republic of Senegal, Mr. Bassirou Diomaye Faye, for having allowed the organization or the hosting of this meeting here. This is what we call leadership. Your Excellency, dear colleagues, I would like to take this opportunity to discuss with you on a concept that is becoming very dear to us African, that is health sovereignty. And when we talk about health sovereignty in Africa, this is not only a political concept, it is a concept that is translated into different various aspects. The first aspect is the financing that should be supported and sustainable, and that should be based on the country's leadership. Second aspect is local manufacturing of our medicines, medical products, including vaccines. Third aspect is the aspect on the innovation of the digital agenda. And the fourth aspect is the PPPR agenda, which is preparedness response to the various outbreaks that hit us. And the last is a reform of the global health architecture. There is no better framework to discuss about all these topics because this impacts immunization as it is done today in our countries. when we discuss about the financing of health, I will give you figures that will hurt, but which translate reality. When we were saying over a year and a half ago that only 20% of when we were saying that we should have the Lusaka agenda to align all foreign partners on the government's positions, some partners were mocking us. Today, truth is catching up with us. For those who follow or monitor the American...
N'arrivait qu'à 40%. 60% restait quelque part. Mais nous disons, ce n'est même pas 40%, c'est 20%. Je vous donnerai l'exemple des Community Health Focus, les relais communautaires dans certains pays. En 2024, j'avais organisé une réunion de tous les partenaires globaux. Les chiffres qui m'étaient parvenus à l'époque, sans y mettre la contribution des États-Unis, puisque c'était difficile pour eux de dire combien ils contribuaient dans le domaine de la santé en Afrique, sans y mettre les données de la Banque mondiale, on m'avait donné un chiffre de 4 milliards de dollars versés pour les communautés Health Focus en Afrique. Où sont ces 4 milliards? Je peux vous dire qu'on n'a pas pu inventorier plus de 1,3 milliard versés en Afrique. Mais imaginez-vous que la Banque mondiale est une réalité, imaginez-vous que le gouvernement américain est une réalité à travers toutes les différentes branches. Et si on ajoutait ces montants, on arrivait à plus de 6 milliards de dollars. Quand on parle de 6 milliards, on a 1,2, 1,3 qui atterrit. C'est cela la réalité de nos pays. Les gros chiffres donnés au niveau global, mais la réalité n'est pas celle-là au niveau terrain. Voilà pourquoi nous avions, sous l'initiative de notre champion, le président Kagame, appelé à une réunion des chefs d'État à laquelle avait pris part le président Faye en février 2024, 2025 pour discuter de cette question et produire ce qu'on a appelé les livres verts, le financement pérenne de la santé en Afrique dans la nouvelle ère. Je vous suggère de relire encore ces livres pour les collègues. Allez sur le site d'Africa CDC, retrouvez ces livres. Il n'y a pas un livre qui résume de la façon la plus compréhensive la situation de la santé, du financement de la santé en Afrique et donne des pistes de ce qui doit être fait. Cette initiative a été relayée plus tard par le président John Mahama lors de la réunion du mois d'août, qui a dit « allons un peu plus loin, soyons un peu plus ambitieux ». Excellents chers collègues, je vais vous dire une chose. N'ayez plus peur des partenaires. N'ayez plus peur des partenaires. Apprenez à dire non aux partenaires. Ils ne vont pas partir, ils vont vous respecter. Moi-même, à Africa CDC, j'en ai fait l'expérience. Quand j'ai commencé à dire non, ils sont revenus et ils ont commencé à me respecter, ils ont commencé à nous respecter. Imposez aux partenaires que vous n'aurez qu'un seul plan. Pas 2 plans, pas 3 plans, pas 5 plans. Un partenaire ne peut pas venir vous demander d'élaborer un plan spécifique pour son financement. Voilà pourquoi aujourd'hui, nous sommes en train de promouvoir encore un plan, un budget, un seul mécanisme de mise en œuvre. Ce que je vous dis, c'est ce que nous avons fait. Pour Mpox, nous avons créé ce qu'on appelle IMST, Incident Management Support Team. Nous avons pu réunir tous les budgets des différents pays en un seul budget. On a pu faire un seul plan. La réponse à Mpox en Afrique s'est basée sur ce seul plan et ce seul budget. Si nous avons fait ça, vous pouvez faire ça. Et je viens de Berlin et de Washington. C'est le même message que j'amène à nos partenaires au niveau global. Arrêtez de nous distraire et arrêtez de nous diviser. Nos pays ont besoin que vous puissiez vous aligner sous leur leadership. Ils ont besoin de présenter un seul plan au gouvernement américain, à la Banque mondiale, à l'Union européenne, au Japon et à tout le monde. Un seul plan, pas deux plans. Quand nous parlons du deuxième pilier qui est la fabrication locale, je suis heureux d'être au Sénégal. Je vais vous donner encore des chiffres qui vont vous choquer. L'Institut Pasteur de Dakar fabrique la fièvre jaune, des vaccins à la fièvre jaune depuis plus de 100 ans. Bien avant que l'Inde, la Russie et d'autres pays ne commencent à fabriquer. L'Institut Pasteur de Dakar a été pionnier. Mais je suis malheureux de vous dire que 70% des vaccins fièvre jaune qu'on utilisait en Afrique venaient de la Russie. Comment cela a été possible? Je suis malheureux de vous dire que l'Autorité nationale de régulation du Sénégal a eu son maturité, comment on dit ça, sa maturité niveau 3 en décembre passé. Comment se fait-il que l'Institut Pasteur de Dakar, qui fabriquait les vaccins depuis plus de 100 ans, et l'Autorité nationale de régulation n'a eu la maturité niveau 3 qu'il y a quelques mois? C'est puisque c'était une volonté délibérée d'empêcher le Sénégal non seulement d'expandre sa capacité, mais aussi d'exporter ses vaccins. Voilà les injustices auxquelles nous faisons face. Voilà la colonisation à laquelle nous sommes astreints. Et nous avons clairement dit, quand j'ai commencé Africa CDC, il n'y avait que 5 pays, Maturity Level 3. Aujourd'hui, on en est à 3. Et d'ici 2026, il faut qu'on en ait au moins à 15. On n'avait pas AMA, aujourd'hui AMA est une réalité. Puisque sans ces autorités nationales de régulation, même si nous crions fabrication locale de vaccins, on n'ira nulle part. Deux conditions majeures, la régulation et le marché. Comme on a réglé le problème de la régulation, on commence à mettre en réseau nos autorités nationales de régulation. PAO, la région de l'Amérique latine, n'avait pas besoin de AMA, a mis ensemble les autorités nationales de régulation pour donner les feux verts d'utilisation des produits. Mais nous, on a besoin des AMA en Afrique, puisqu'il y a 55 pays et on doit être sûr que nous parlons d'une seule voix. Le deuxième aspect, c'était le marché. Nous avons créé l'African Pool Procurement Mechanism. Excellents chers collègues, savez-vous ce qui se passe au Botswana et en Namibie? Le président du Botswana a dû même déclarer ce qu'on appelle l'état d'urgence par rapport au manque de produits, puisqu'il y a des gens qui sont des intermédiaires qui ont augmenté les prix à des niveaux inimaginables. Aujourd'hui, les deux pays ont demandé à Africa CDC de les aider. En faisant ces procurements de ces produits, on a sauvé plus de 70 à 75% des fonds alloués aux commodités dans ces pays. Et ces fonds ne vont pas retourner à la caisse de l'État, va aller au niveau des soins de santé primaires pour renforcer les soins de santé primaires. Voilà ce qui fait que la fabrication locale de vaccins, surtout dans un pays comme le Sénégal qui est pilote, aujourd'hui nous parlons de Lassa Fever Vaccine, maintenant nous sommes confrontés au Rift Valley Fever. C'est aussi cet élan que nous devons avoir. Fabriquons nous-mêmes nos produits pour faire face à cela. Et je sais que vous avez des difficultés pour trouver des vaccins et autres. C'est le moment pour nous de trouver ces solutions. Le troisième aspect, chers collègues, c'est l'agenda de la digitalisation. Quand l'USAID a arrêté son programme en Afrique, ce n'est pas seulement le programme qui a été arrêté. Même les données se sont envolées. Du jour au lendemain, le ministère n'avait plus accès aux données. C'est cela la dépendance, c'est cela la colonisation. Nous n'en voulons plus. Vous allez voir, à partir de la semaine prochaine, on va commencer une consultation de nos pays par rapport à l'agenda de transformation digitale qu'Africa CDC a développé pour que nous puissions avoir vos inputs. puisque nous voulons que cet agenda soit adopté par les chefs d'État en février 2026. Ce sera le cadre qui va permettre l'indépendance de l'Afrique dans le domaine digital. Nous ne voulons plus que nos données s'envolent. Nous voulons avoir nos propres données que nous allons gérer nous-mêmes et nous allons avoir ce qu'on appelle les data sharing agreements entre différents pays et les niveaux continentaux. L'Europe l'a fait, l'Afrique le fera. Mais pour cela, on a besoin de la connexion, la connectivité. Beaucoup de nos régions, beaucoup de nos pays dans les milieux ruraux ne sont pas connectés. Je suis heureux de vous dire que nous venons de finaliser un MOU qui va couvrir les niveaux continentaux et qui nous permet de négocier le meilleur prix. Je serai encore aux États-Unis en début novembre pour signer ce MOU avec le président de Starlink pour permettre à ce que nos pays puissent avoir une bonne couverture, que ce soit dans les milieux ruraux que dans les milieux urbains, afin que nous puissions commencer à avoir les National Data Intelligence Center pour bien gérer nos données. Et attends. Le quatrième, c'est la réponse aux épidémies. Nous sommes encore dépendants. Mais cet agenda change. Je voudrais remercier et féliciter le ministre Si. Hier, il a organisé une réunion. C'est un modèle de réunion que nous voulons voir dans différents pays, amenant les politiques, les scientifiques et toutes les personnes impliquées pour discuter. Et j'ai même appris que quand nous venons avec le moustiquaire imprégné, nous le mettons à la maison, les entomologues nous ont appris hier qu'en fait, ce moustique pique de 18h à 20h à l'extérieur de la maison. Alors, à quoi ça sert de mettre le moustiquaire à la maison si les jeunes sont piqués à l'extérieur? Vous avez eu cette information puisque vous avez impliqué les scientifiques. Voilà le modèle que nous voulons. Qui vous a dit que nous manquons l'intelligence pour répondre aux épidémies? Qui vous a dit que nous devons avoir besoin des gens qui viendront des États-Unis, du Japon, de la Chine? Non. Nous avons l'intelligence. Nous devons apprendre à l'appliquer. Merci, Monsieur le ministre. Je pense que vous méritez des applaudissements pour ce leadership. Et le dernier agenda, bien sûr, dans cette souveraineté sanitaire, c'est la réforme de l'architecture sanitaire internationale. Notre frère Mihigo l'a dit avec Gavilip. Gavilip n'est pas seulement une voie pour le financement de la santé, mais Gavilip, c'est un modèle de réforme de la structure de gouvernance sanitaire. Si eux ne le disent pas, moi je le dis. Si eux, ils ont peur qu'ils vont être bouffés, moi je le dis haut et fort que Gavilip, c'est la voie que nous, Africains, nous avons voulu depuis longtemps pour utiliser afin d'amener tout le monde autour de la table. Aujourd'hui, cette réforme signifie quoi? Quand moi j'ai commencé il y a près de 30 ans ma carrière dans le domaine de la santé, c'était le niveau global vers les pays avec une condescendance et un manque de respect. Aujourd'hui, cela ne se fait plus. En Afrique, la seule autorité a déclaré une situation d'urgence de santé publique continentale. Ce n'est plus un organe global, c'est Africa CDC, tel que les chefs d'État l'ont voulu. Aujourd'hui, chaque pays, nous avons laissé le Sénégal prendre des leads, gérer son épidémie et nous dire à nous de quoi ils ont besoin. Ce n'est pas nous qui venons dire au Sénégal de quoi ils ont besoin. La régionalisation est en marche. Je tiens à vous dire, chers amis, pour l'une des rares fois, je suis heureux et fier d'être africain, puisque aujourd'hui, le modèle d'Africa CDC inspire toutes les autres régions du monde. Vous avez vu, il y a quelques mois, dans les Lancet, des scientifiques de l'Amérique latine ont publié pour que PAO devienne comme Africa CDC. Je peux vous dire que nous avons reçu des invitations pour aller dans la région ASEAN, pour que ASEAN devienne ASEAN CDC dans le modèle d'Africa CDC. Nous avons les Global CDC avec qui nous collaborons pour les mêmes modèles. L'Afrique inspire le monde. Vous devez être fiers de ça, puisque c'est grâce à vous et avec vous que l'Afrique est fière. Excellence, chers collègues, vous allez me dire, le DG nous a fait un discours politique. Non. Le DG vous a fait un discours réaliste, basé sur les faits. On n'arrivera jamais à vacciner nos enfants si, un, nous n'avons pas de financement adéquat. Et ces financements, ne rêvons plus. Ça ne viendra plus des États-Unis, ça ne viendra plus de la France, ça viendra progressivement, mais de façon pérenne de nous-mêmes. Beaucoup de des ressources domestiques avec des ressources innovantes. Deux, cette vaccination ne se tiendra pas si nous ne fabriquons pas nos propres vaccins. Trois, cette vaccination ne se tiendra pas si nous n'avons pas un système de surveillance adapté. Et quatre, cette vaccination ne se tiendra pas si nous n'avons pas un système digital qui nous permet rapidement de collecter les informations et de les mettre en œuvre. Et cinq, cette vaccination ne se tiendra pas si nous n'avons pas la souveraineté de nos données pour discuter avec les autres. Voilà les 5 points qui ont même fait l'agenda de la souveraineté sanitaire en Afrique. Celui qui doute de cela, nous sommes ouverts pour le dialogue. Mais nous, Africa CDC, nous avec nos ministres, nous avec nos chefs d'État, nous ne doutons pas de cela. Je vous remercie.
Excellence, docteur Jean Casseya, merci pour ce plaidoyer. Merci beaucoup pour ces appels forts. Vous avez dressé l'agenda de la souveraineté sanitaire et vaccinale pour l'Afrique de l'Ouest et même, je dirais, pour l'Afrique. Merci pour ces mots forts. Je vais vous demander de l'applaudir une deuxième fois, s'il vous plaît. Et j'appelle à présent le docteur Ibrahim Assi. Excellence, si vous voulez bien. Vous êtes le
His
ministre de la
Excellency,
Santé et de l'Hygiène publique.
Minister of Health and Public Hygiene of Senegal.
Et vous avez la parole, Excellence.
The floor is yours. Thank you.
Merci beaucoup, Madame la modératrice.
Thank you very much,
Je ne sais
Madam
pas si mon
Moderator.
discours pourra porter
I
après
don't
celui
know if
que
my
le directeur
speech
général de
will
la
resonate
CDC vient
after
de
the
prononcer.
wonderful speech from
C'est
the
un discours
Regional Director of
diplomatique
Africa CDC.
très engagé,
This,
aussi
of
un
course,
discours
is
très
a
technique
highly
et
committed
très réaliste.
and
Et je voudrais vraiment vous
technical yet
remercier pour
realistic speech that we've just
ces
listened
mots
to.
qui sont très
I would
forts
like to
et ce sont des
extend
mots
my
qui vont
deepest
soigner des maux.
gratitude for
Et
these
vous remercier,
words that will heal wounds.
vous remercier
And I
également
would like to
votre
also
engagement
thank you
et
for your
votre
commitment,
leadership au niveau
your
africain.
leadership at the
Mais les
African
défis restent
level.
encore énormes.
Challenges,
Il va
however,
falloir se préparer
remain
à faire
colossal.
encore des discours
We
très
need
engagés.
to stay ready, prepared
Monsieur le
to make more
ministre de la
committed
Santé de la
speeches.
Gambie, Dr Ahmed Lamine
Honorable
Samaté,
Minister of Health of
Monsieur le
the Gambia,
ministre de la Santé de la Guinée-Bissau,
Dr. Amadou Lamine
Dr
Samate,
Augusto Gomez,
Honorable Minister of Health of
Monsieur le
Guinea-Bissau,
directeur
Dr.
général de
Augusto
Africa
Gomez,
CDC, Dr Jean Casseya,
distinguished Dr. Jean Casseya,
Monsieur
Executive
le directeur
Director of
régional de
Africa
l'UNICEF pour
CDC,
l'Afrique de l'Ouest et du Centre, Monsieur Gilles
distinguished
Fagninou,
Gilles
Monsieur le
Fagninou,
représentant
Regional
de
Director
Gavi
for
à cette
West and
région,
Central Africa
Dr
to
Richard
UNICEF,
Yodo, Madame l'ambassadrice au Niger, au
distinguished
Sénégal, Mesdames, Messieurs les
Dr. Richard
vice-ministres de la
Migo from
Santé
Gavi,
et des Finances, Mesdames, Messieurs les directeurs généraux,
distinguished
directeurs et conseillers techniques,
ministries and
chers
deputy
représentants
ministries of
des
health,
communautés économiques régionales, Mesdames, Messieurs
dear
les délégués,
representatives of
partenaires et collègues,
local governments,
Mesdames, Messieurs les experts,
delegates,
chers invités
experts,
en vos rangs,
ladies and
qualité,
gentlemen,
fonction
all
et grade,
protocols
tout
observed,
protocole observé, bonjour.
good morning.
Il me soit aujourd'hui l'honneur
It
et le
is
privilège
with great
au nom de Son
honor and
Excellence,
privilege
Monsieur le Président de la République
to
du
open,
Sénégal,
on behalf
Bassirou Diomaye
of His
Diakhar Faye,
Excellency the President of the
cette
Republic of Senegal,
d'ouvrir cette
Mr.
importante
Bassirou
rencontre
Diomaye Diakhar
ministérielle
Faye, This important ministerial meeting dedicated to immunization in West Africa. I would like to extend our deepest gratitude to Africa CDC, to the African Union Commission, to Gavi, to the WHO and UNICEF for their joint leadership. These institutions continue to join forces to support our vaccination programs and strengthen our continent's health sovereignty. This forum is open in a context where the continent's vaccine sovereignty is more important than ever. As Africa CDC Executive Director Dr. Jean Kaseya recently emphasized, local vaccine manufacturing will be Africa's second independence. This vision deeply resonates with the ambitions of Senegal and the whole of West Africa, which is facing emerging health threats that requires massive investment in vaccination to not only reduce preventable deaths, but to also lower future health expenditures. Please also allow me, on behalf of the government of Senegal, its Prime Minister, Mr. Ousmane Sonko, and the Senegalese people, to welcome all delegations to Dakar. Your presence demonstrates a strong Pan-African solidarity and a shared desire to make immunization a pillar of our health, security, and economic development. The forum's topic, strengthening immunization for a healthier West Africa, through commitment, innovation, and equity, translates our current spirit, sustainable commitment, innovation driven by African science and social equity that guarantees that every child, wherever they are, has protected rights. As several speakers pointed out, more than 90% of vaccines used in Africa are still important, while 1 in 5 African child remains deprived of essential vaccines. This figure is no mere statistic. It is a call to action, solidarity, and shared responsibility. As the host country, Senegal is proud to embody an Africa which takes its health destiny into its own hands. Our country devotes 10% of its national budget to health and promptly honors its contributions to co-financing vaccines. With the Madiba project and the Diamniadio Vaccinopole, Senegal makes the strategic choice to locally produce up to 300 million doses per year for its local needs and the ambition to meet West Africa's needs. This partnership with Institut Pasteur of Dakar is a concrete response to excessive dependence on imports, but also a symbol of sovereignty and confidence in African science. Specialized media and experts have emphasized that this forum represents a historic step towards immunization in West Africa and the creation of regional monitoring mechanisms. This message is at the heart of our discussions, ensuring predictable, equitable, and sustainable funding through the involvement of governments, the private sector, and financial and technical partners. This forum provides a space for reflection, consultation, and decision-making, experts discussed
Les
innovations
ministres porteront la voix politique du
and
changement
operational
et les chefs
challenges.
d'État adopteront
Ministers
la
will be the
déclaration
political
Dakar,
voice of change,
un texte
and heads of
d'engagement
state will
fort pour
adopt
la
the Dakar
vaccination et la
Declaration,
souveraineté
a strong
sanitaire
commitment
en
to
Afrique de
vaccination
l'Ouest.
and health
Cette
sovereignty in West
déclaration
Africa.
attendue par nos populations
This
est
declaration,
largement
eagerly awaited by our
relayée dans
populations
les médias régionaux,
and widely
marquera un
reported
tournant
through regional
dans
media,
la gouvernance
will mark
de
a
la santé
turning
publique
point
africaine.
in African public
Mesdames
health
et
governance.
messieurs,
Ladies
la
and
vaccination n'est
gentlemen,
pas seulement une mesure de
immunization
santé
is
publique,
no mere
c'est
public
un acte
health
de
measure.
justice,
It is
d'équité et
a
de dignité.
social
Chaque
justice,
enfant
equity,
vacciné
and
est une
dignity
victoire contre la
act.
maladie,
Each
contre le décès
vaccinated
prématuré,
child
contre la
is a
pauvreté
victory
et
over
contre
disease,
l'injustice.
poverty, and social
Nous devons
injustice.
désormais
Now,
renforcer la
we
confiance
must
des
strengthen
communautés,
community
garantir la
trust,
continuité des
ensure
financements domestiques,
continuity for
encourager les
domestic
investissements
funding,
du secteur privé et de la
encourage
diaspora
investment
africaine
from the
et
private sector
promouvoir les
and
innovations locales
the
dans
African
la
diaspora,
production et
and
la
promote
distribution des vaccins.
local innovations
Sous
in
la
vaccine
vision de
manufacturing
son
and
Excellence,
distribution.
Monsieur le Président de la République,
Under the vision
Bassirou
of
Diomaye
His
Diakhar
Excellency,
dans le
the
cadre de
President of the
l'agenda
Republic,
national de
Bassirou Diomaye Diakhar
transformation
Faye,
Sénégal
and within the
2050,
framework
la
of
santé
our
et le
national
capital humain
transformation
constituent
agenda,
un socle du
Senegal
développement équitable
2050,
et durable
health and
dont
human
la
capital
vaccination est
constitute the
appelée à jouer un
foundation
rôle
of Senegal
important.
equitable and sustainable
Une
development.
Afrique capable de
An
produire ses
Africa
vaccins,
capable of
de financer
manufacturing
ses
its own
programmes
vaccines,
et de
funding
protéger
its
ses
own
enfants
programs, and
est une
protecting
Afrique respectée,
its children
souveraine,
is a
unie,
respected,
unie,
sovereign,
solidaire,
united,
en bonne santé.
solidary, and healthy Africa.
Je reste convaincu que
I
ce
remain
forum
convinced
aboutira
that
à des
this forum
recommandations
will lead
concrètes,
to tangible recommendations that are realistic,
portées par la
ambitious,
déclaration
and
politique de
supported
Dakar,
by the
la
political
feuille de route régionale pour le
Dakar
financement de la
Declaration, as well
vaccination.
as the roadmap
Elles
for
traduisent la
funding
volonté
of
d'une Afrique
immunization.
agie, qui
It will
investit et qui
translate
protège.
an Africa that is
Sur cette note
actionable, that
d'espérance
invests,
et de
and that protects.
détermination, c'est sur
On
cette
this,
note d'espérance
it
et
is
de
on this
détermination
note
que je
of
déclare ouvert le
hope
segment
and determination
ministériel
that I
du forum
declare
régional
open the
de haut niveau sur la
ministerial
vaccination en
components
Afrique.
of
Et je vous remercie
the
de votre
high-level
aimable
regional
attention.
forum on immunization in West Africa. Thank you for your kind attention.
Merci beaucoup, Excellence Dr. Ibrahim
Thank you
Assi.
very much,
Le Sénégal
His
prend son destin
Excellency,
sanitaire en main. Le Sénégal
Dr.
s'engage
Ibrahim
pour une bonne
Assi.
gouvernance de la
Senegal
santé.
is taken
Ce
into
sont là
its
encore
own
des mots
hand
forts.
health
Vous avez
governance,
dit vous-même,
as
des
you've
mots
said
qui soignent les
yourself,
cerveaux.
strong words,
Mesdames et
words
messieurs,
that
est-ce que
heal
vous pouvez
wounds.
à nouveau
Ladies
applaudir
and
s'il vous plaît
gentlemen,
très
let us
fort?
please clap for Honorable Minister once more.
Merci beaucoup, Excellence.
Thank you
Ministre de la
very
Santé
much,
publique du Sénégal,
His
Dr. Ibrahim
Excellency
Assi. Voilà,
Dr.
je vous prie
Ibrahim
d'avancer,
Assi,
si vous voulez bien,
Minister of
messieurs, pour les
Health of
photographes.
Senegal.
Nous allons
Please
faire
step
3 séances
forward as we're going
de
to
photos de famille. Voilà,
snap
merci
a
Dr.
few
Kasseya
pictures.
pour le protocole.
Thank you, Dr. Kaseya, for assisting with protocol.
Les photographes, les preneurs d'images, voilà, je vous laisse vous positionner. Nous aurons
I am
donc
now
une première
going
photo
to announce a first
avec
round
nos
of
honorables ministres, les excellences
pictures
qui vont faire leurs photos
with
maintenant. Et puis nous
honorable
demanderons aux
ministers.
partenaires, à nos
Then we are
invités,
going to
de
ask
bien
our
profiter des premiers rangs,
distinguished guests
de
on
rejoindre
the
ensuite
first row
la scène
to
pour
join
la deuxième
the
session de
stage for
photos.
the second session of pictures.
Photographe. Dès que vous êtes prêts, nous pouvons passer à la deuxième session.
Please let us know when we can proceed with the second
Mesdames et
round of
messieurs,
pictures.
au premier
Ladies and
rang,
gentlemen
les
sitting at the
partenaires,
first row,
si vous voulez bien nous rejoindre,
our
mesdames,
financial and technical
veuillez
partners.
at the first front. At the front, please, at the first row, please join us on the stage. Voilà. Avec l'aide des photographes, on va faire quelque chose de nickel, vous verrez.
We will have wonderful pictures, I am sure, with support from our photographers.
À l'école, on nous disait les grands derrière, les moins
In
grands devant.
school, we used to be
N'hésitez
told
pas à
tall
faire,
ones at the back, less tall ones at the front. Please make sure to follow this rule.
Voilà, pendant que nos hôtes se placent,
As
je vais demander de
we
préparer également
wait
pour la
for
troisième session de photos ensuite
our
avec les participants qui
guests
souhaiteront nous
to
rejoindre sur scène. Voilà, tout le monde est là? On peut y aller.
we'll get ready for the picture. I would like to ask the remaining participants to please prepare themselves for the third round of pictures.
Voilà, les photographes, les preneurs d'images. Merci d'immortaliser cet instant.
Thank you for enshrining
Dès que vous êtes prêts, nous pouvons
this
passer donc à la
moment
dernière photo de famille. Cette fois, c'est la photo de
through
groupe.
pictures. We are now going to take
Avec
a
ceux qui le
larger
souhaitent.
group picture with all those who would like to join.
C'est bon? Voilà. Mesdames et messieurs,
Ladies and
those of you
gentlemen,
who want to join us on the stage, you are most welcome. Delegations from Ivory Coast, Nigeria, Ghana, Sierra Leone, Liberia, Guinea-Bissau. I had Mali is here, Niger, all the countries, the delegates, the partners, civil society, you're most welcome to join us on stage. Voilà, tous les partenaires sont invités, évidemment, également le Sénégal, notre pays hôte, les académiques, les experts techniques. Voilà. Welcome. Docteur Diane, allez-y, il y a encore une place devant, je vous en prie.
Dr.
Tout le
Jane,
monde est là?
there is still more space.
Voilà, merci.
Please.
Après cette photo, nous aurons une pause café, et puisque le ministre nous autorise
We are
maintenant à
going to
commencer nos
proceed
travaux,
with
Dr Ibrahim Assi,
a
nous pourrons ensuite
coffee break,
poursuivre avec le
given
reste du
that we now
programme.
have the minister's approval to proceed with the ministerial panel
Je laisse
after the
l'honneur
coffee break.
s'établisser. Je vous invite donc à rejoindre, d'abord à applaudir pour vous-même, mesdames et
Please
messieurs.
clap for yourselves, ladies and gentlemen.
Merci beaucoup.
Thank you very much.
Nous allons donc nous rendre
So,
au rez-de-chaussée pour la pause.
we're going downstairs for the break.
Rapide pause café, rafraîchissement.
Take some refreshment, some coffee,
Et puis nous reviendrons dans la
and
salle.
then we'll come back to this room.
Nous aurons une pause d'environ 10 minutes, maximum 10 à 15 minutes, et puis nous pourrons revenir
Maximum 10-15
pour la
minutes
suite
break,
du
and then come
programme.
back to the room for the remainder of the agenda.
S'il vous plaît, nous demandons au personnel de Africa CDC, staff, please join us on stage. Le personnel, merci, M. Paninou. Nous demandons au personnel d'Africa CDC de bien vouloir rejoindre l'équipe sur le podium, s'il vous plaît, pour immortaliser l'instant. Currently, they're calling you. Teresa, they're calling you.
Yes. Yes.
Mesdames et messieurs, juste pour vous informer que nous allons reprendre.
Ladies and gentlemen, just to inform you that we will be back shortly.
Merci, mesdames et messieurs, de vous lever pour l'arrivée donc de nos autorités, de les accueillir à nouveau, s'il vous plaît, sous vos applaudissements. Merci beaucoup. Merci, merci à la troupe Bakalama. La troupe Bakalama qui donc a presté devant nos autorités des danses traditionnelles du Sénégal.
Thank you to the Bakalama group, which were performing for the authorities the dances of Senegal. Thank you very much. The Bakalama group will proceed with our program and the agenda.
Donc, par rapport à notre programme qui est très chargé.
With regard our agenda, which is very busy, we are a little bit behind deadline, and we apologize for that. We'll continue with the program. I am inviting Gashingongo, lead advisor of the DG of CDC, for the continuation of our program.
Merci beaucoup, Madame la modératrice.
Thank you very much, Madam Moderator.
Excellence, Monsieur le Ministre.
Excellencies, Honorable Minister, and Deputy Ministers, distinguished guests.
Nous sommes arrivés donc à la deuxième partie.
We have come to the second part of our meeting of today,
le point que
which
les
is
vont nous faire sur
the items or the situation which the technical team will give us
pour cela,
about the summary of their deliberations for the 2 past days. And for that, I am going to invite on the podium our panelists, the Minister of Health, of Public Hygiene of Senegal, Dr. Ibrahim Sy. Honorable Minister, would you please proceed to the podium? The Minister of Health of the Republic of Gambia. So,
puis le ministre de la Santé de Guinée-Bissau, le docteur Augusto Gomez.
And the Minister of Health of Guinea-Bissau, Dr. Augusto Gomes, and we're going to invite the Honorable Martha Morris, the Deputy Minister of Health of Liberia.
We are also inviting Dr. Godin Tandom, the Director of Public Health of Nigeria. Dr. Godwin is in the room. He stepped out? OK. And on a aussi en ligne Prof. Charles Senesi, le vice-ministre de la Santé de Sierra Leone.
Peter, Minister of Health of Sierra Leone, he's online and he is on the panel, and he told us that he will be able to speak from online. During this session, we are going to invite 3 speakers. First, Professor Tandaka Jai, could he please come to the podium, and he will be followed by Mr. Chiluba Mwala from Africa CDC, advisor on local manufacturing, and we're going to have Dr. Landry Sage, Director of Primary Health Care at Africa CDC. During this session, we wanted to present to the honorable ministers the summary, the gist of our discussions on the 3 key elements. The first topic being increasing vaccine coverage and reaching each zero-dose child, including in a humanitarian context. And we are going to give stock of the situation and mention a few successes which we had and the major challenges and the technical recommendations on the technical team on actions to help the coverage, improve the coverage of zero dose. This will be done by Professor Njai. Then we'll have a second production on speed up the local manufacturing of vaccine for vaccine sovereignty, which will be done by Mr. Muela. And then we'll conclude with the third topic, which is the increase of domestic funding of health, which Dr. Sage will do for us. We'll have 10 minutes for each presentation, and we'll give 5 minutes to each of our panelists to react on the presentation. And for us, it is the opportunity to listen to the contributions and inputs to improve the recommendations done by the technical teams. This is how we are going to work during this session. Without any further ado, I would like to invite Professor Njai to come up to the podium for his presentation. Now on the screen for our panelists, this is a simple outline. We listen to the presentations of the technical work. We collect the contributions and inputs of the honorable ministers, and these contributions will help us finalize the final communique, which will be presented later based on the enrichment of the panel discussions. So on this note, I would like to invite Professor Njai to deal with the first topic. Thank you very much, dear Ngassi, for giving me the floor. I would first like to warmly command the presence of all the ministers of health of our various countries, the neighboring countries of Senegal, which are countries also of West African countries. Thank you very much, Honorable Minister of Health, for having organized this high-level meeting, which is also high value, but also with the support and assistance of Africa CDC, which has shown its leadership or at least built ownership of this problematic here in Africa. So I have the task, I've been tasked to be the chairperson of the scientific committee of this high-level forum. So it was a daunting task, but in the end, I was really very happy because I learned so many things revolving around immunization. And that is why Dr. Jean Kaseya gave me huge pleasure because we speak online very often, but I was very happy to see him face to face and seeing his commitment is impressive. It is to say that in Africa we have truly committed people to lead us forward. So I was discussing yesterday with Richard Migo, with whom I have worked for 25 years on immunization. So we were so committed, but we had faced so many bottlenecks, and it will be impressive to see what will be in this slide. We are talking still, we are saying that we must reach each child, and we see that there are zero-dose vaccines in Africa. This is impressive, surprising, because when we're talking about vaccines, they've been created, since the 1800s. There's so many vaccines which have been development, and then in fact WHO brought us to put in place the immunization programs in 1950. So, and today we are talking about that we should reach each child, and we have zero-dose children. So what does it lead us to? Figures. I like really figures. So when we say that in 2015 we had 15 million zero-dose children, that means that they didn't receive one single vaccine. That means that we didn't reach them. What happened? That is why it is interesting to have similar meetings, because this will enable us to identify avenues that will lead us to these children. You know that in West Africa, we have about 100,000 children of less under 5. If you take, in fact, 15,000 which are not immunized, that is a true public health issue. So we find these people in conflict areas where we have a humanitarian crisis, because we know that in West Africa we have many of such crises, and in Africa in general. So we should find means and resources, and that is why I was happy to have met yesterday our friends from Mali, from Niger, who showed us who are in situation of conflict, and who, told us about their know-how, and the community helped these countries reach this target. What you should know is that there is 35%, 8.2 million children zero dose in Africa. So I'm looking at Guinea-Bissau. So how many? 2 million in Guinea-Bissau. So that is 7 times. So that is 7 times Guinea-Bissau, the population of Guinea-Bissau. So that is why I like figures. So 14 million zero dose is 7 times the population of Guinea-Bissau. Nigeria is a large country of Nigeria. You have 2 million zero dose children there. And to go further, let me show you this graph. Sometimes people don't like the graph. Maybe it's not too legible for the honorable ministers, but we'll make a small efforts to closen that. If you look on top, you have Nigeria from 2021 to 2024. So you can see the number of people who were not reached. So zero dose remained the same. Things did not move. What hasn't been done there? These are questions that should be asked. It's 4 years now that we have stagnated at the same level. You see, Cote d'Ivoire comes next. So it is a quasi-similar case, but there are countries where we see improvement, and that is what is interesting. We should learn from these countries. For example, if you take Togo or Sierra Leone, maybe, you see that all of a sudden it went down, then it went up. So you have fluctuations. We don't really have that situation under control. We should have them under control. We must be able to manage this situation, have them under control, and reach these children. So I am showing this graph. So it is red. And so when it is red, that means things are not are wrong. It means stop. But you see 2 spots inside that are green. So what does it show? So to reach In fact, our children, we must be up to 90% of vaccine coverage, and we are below 90% vaccine coverage. In the 1997s, you have 16 different vaccines that were administered. None of these 16 reached 90% of vaccine coverage. This is at the African level. So some people will say, yes, we improved. Yes, I agree. There's been an improvement. Not everything was bad. Is bad. So because if you see here, this on this slide, you see green, and we are happy. So here, I'm showing year after year, country after country, where is the green? And when you look at the green, you see that you have countries which somewhere have a good vaccine coverage. We must learn from them. So the first is Cape Verde. So you will say, tell me, there are just 500 people, but yet they've achieved, made results. Then follows Nigeria, and then you have gaps. Then you have yellow, and then after you have red. So we must do considerable efforts to resolve or fill that gap and reach our children. This is important. This forum is really timely and has enabled to show all this, because really I am embarrassed as a vaccinologist. I've been working on this discipline many years, and people are always telling me, how do we do to reach this coverage rate? Okay, so it is you are to blame. So there must be a synergy between the Ministry of Finance, which is providing the funds, and the Ministry of Health. They must work together, and I'll show that later. So we have obstacles that we have, hurdles, so which I am going to summarize. We have insecurity, geographic barriers, conflicts. So, of course, and poverty will come further, worsen with conflicts. And then we have systemic, in fact, issues. We have weak health systems, and we come back to financing. So insufficient financing and unpredictable financing. So we suffered. People would say during the COVID-19, in fact, there's so much disinformation around the vaccines that we should develop communication to make people understand. Now there are successes and promising initiatives. Everybody agrees. During these 3 days, everybody agreed. The panelists, the specialists agreed that we must have a good combination of vaccination and other elements of health. Primary health care came over and over again. We must have a community-based approach. So that is the involvement of community health workers, dialogues with the leaders, religious leaders, customary leaders, women leaders. Yes, leaders must be involved more. Then there is innovation and digitalization. We should have systems of mobile data. Everybody has got a mobile phone now. Everybody is connected. Everybody is in the networks. So we must be able in real time to manage that, to monitor the campaigns. We must have platforms for better vaccine stock management. The stocks must not be expired. During COVID-19, we had many expired stocks. Okay, and then we have also, in fact, targeted catching up campaigns, vaccine immunization campaigns. Now, from all these honorable ministers, we members of the scientific committee and experts have made recommendations. And I think that is where we want your feedback. So recommendations to reach the children. What we want here is we have three subtopics. Number one, we must have a strong governance and political leadership. We are very happy that President Jamai Faye accepted to organize, to hold this meeting here in Dakar to boost immunization. We should not miss that opportunity. We must sensitize more. Earlier, the media took much of our time, but the media is good. So we should strengthen the multi-sectoral coordination between health, education, social affairs. We put everybody together and communicate appropriately so that people know what we want, because a child who dies is a disaster, especially when he dies from a vaccine dose that costs peanut. We should decentralize planning and accountability by entrusting to the local communities. Local communities are really important. They have incredible levers and channels to enable us to reach the desired medical coverage and monitoring. Second element is the integration of immunization in primary health care. So we should not dissociate the two. We should systematically integrate immunization in the primary health services, strengthen service provision at community level, and promote the use of mobile teams and targeted catching up campaign and guarantee the immunization continuity during the crisis, thanks to humanitarian emergency plans that take on board all the priorities of first frontline immunization. And last topic, the data and digitalization and performance monitoring. We must say that this is what we did, this is what didn't work, this is what should be improved. So in real time, we must be able to understand that. So we should have strategies, that any continental strategies of digital transformation and health data. I was happy to say that Dr. Cassie said that we should protect our data. Our data are everywhere. So we should be able to channel them, deploy digital registers, immunization registers, geolocalization tools to locate zero-dose children. This we can do. That's not very complicated. And then put in place a regional monitoring mechanism and accountability mechanism coordinated by Africa CDC. I think that this is in the roadmap that we are going to show you later, and we'll revisit all this to say that all this must be put in well, in good order, but also coordinated. So earlier I heard many addresses this morning. It is because of a lack of coordination at African level that each of the buyers will come in a silo, give things, and Africa CDC, can very well solve that. And I was impressed by the leadership and the commitment of Jean Castella. So this is our role. It would be a pity to leave this forum and that in 1 year's time we come again and say we are at the same level there are children which we didn't reach. This is our responsibility and our commitment that must be priority. We must be able to immunize and vaccinate our children. These are our children. We shouldn't abandon them. And everybody is well aware that immunization saves lives. In the northern countries, if they can have 90% coverage, I assure you, we can do the same. Next week, I'll be in Johannesburg because I am the member of the commission that supervises the elimination of measles and rubella in Africa. In 2019, some countries were verging the eradication of rubella. COVID-19 disrupted everything. So rubella is the proof and an evidence that proves that immunization impacts, has an impact on the population. So, and it kills, it is very deadly, lethal as a disease. So I thank you, and we are open to the panelists for questions and answers.
Merci beaucoup, Prof. Ndiaye, pour
Thank you very much, Prof. Ndiaye, for this excellent presentation. So, honorable ministers, we've just heard the summary of 2 days discussion on the zero dose coverage. Many good news. That means that when you have the regional situation is red almost everywhere, but when the data were disaggregated as per country with so many greens, we have 7 countries in the sub-region out of 16 which have a coverage of a PT3 of over 90% and 12 are over 80%. These are good news, but there are also the challenges which were mentioned, especially with the zero dose children. So Nigeria has 2.2 million of zero dose vaccine out of the 2.8 million zero dose children in the region. And there are countries such as Benin, Guinea-Bissau, Burkina Faso, where the number of zero dose doses, those children is increasing. Now, the good news is that we have good practices in the region from the various countries and which guided the 3 recommendations which were done, that is governance and leadership, integration of immunization in primary health care, in particular in the community-based health and digitalization and innovation and data. So we have another recommendation from this group related to funding, which we are going to deal with in the last section of this forum today. So, honorable ministers, excellencies, I am going to turn over the floor to you for your recommendations. Maybe I will start with Dr. Ibrahim Assi, the Minister of Health and Public Hygiene of Senegal. Excellent, Honorable Minister. You have the floor, 5 minutes.
I am highly satisfied with the results shared regarding the first topic on increasing immunization coverage and reaching every zero-dose child, including in humanitarian crises. I believe the diagnosis was very well presented, and we've seen where challenges lie. With each challenge, we've identified clear recommendations, clear measures to be implemented. Now, I would like to speak on what type of new political commitment is required, what type of advocacy should we design to bring all our communities to also commit themselves so that we may definitively resolve zero-dose cases. What particularly piqued my interest is that this diagnosis reveals social and territorial inequity. When it comes to social equity, we're talking about eventual vulnerable strata. We might be thinking about vulnerable groups that might not have access to vaccines or might not have access to the right information to get vaccines. Then when it comes to territorial equity, when confronted with the land issues in our countries, or accessibility issues, despite political will always have remote or faraway spaces. However, today, I believe that innovations are arrived for vaccines to be available across territories. And I believe Senegal is an example of such. I know I only have 5 minutes, but please allow me to remind one and all of the importance of immunization. And it is only in hindsight that we take full grasp of it. Myself, when I was in primary school, lost a friend. And then I lost another friend in middle school. And when we're told why, it's because they were zero-dose cases. And God only knows how brilliant these children were. And they might be alongside us today participating in this high-level meeting had they had the chance. So it is paramount, it is capital to save children now and in the future, to allow them to take part on our society. Thank you.
Merci beaucoup, Excellence.
Thank you very much, His Excellency.
Maintenant, nous allons inviter le docteur
We are now going
Amadou
to
Lamine
give the
Samaté
floor to Dr. Amadou Lamine Samaté from the Gambia for his remarks.
Sure, Mr. Moderator. Well, before I delve into what I think, I'm not sure if we are going to talk about everything together or one of the recommendations, then we'll get the chance to talk about the other and the third one because of the time factor. Otherwise, we can go ahead and say everything in one go. Thank you very much. First of all, I want to use the opportunity to thank Professor and the technical team for all the hard work that transpired over the past days, the deliberations, the debates, and then looking at the data. I think immunization, as we said in our speeches in the morning, is a very important step in taking care of our people, especially children, who will grow to become future leaders of our countries. Professor gave some bright pictures in some areas and some difficult ones in other areas. But when it comes to leadership, it is fundamental. It is fundamental in the sense that whatever is needed, most of it has to be led by the leadership. Of course, sometimes we sit down and ask ourselves, typically, who is responsible for making sure that these children get immunized? Then we look around and look around, really is no other person than ourselves. So you see the volume of responsibility on our shoulders. So the teams really need to continue to work hard. At the political level, I think we are very fortunate in Africa now that we have very, very committed leadership from the heads of state who are very, very passionate about health service delivery on our continent. This has been manifested in the support we get as health ministers. I get tremendous support as a health minister in the Gambia, and I'm sure it's the same for other countries too. I'll give you one typical example. When it comes to financing, when we were discussing our budget some ago, I was not satisfied. I had a big push with the finance minister. I say, yes, you are talking about development, you are talking about this, you are talking about that. But we cannot have all those if the people are not healthy. We need healthy population to work on the farm so that there'll be productivity. We need healthy population to do the road construction and so on. But of course, we know finance people are here. But why I'm saying this, at some point, the president intervened and he said health is so important, increase the health budget by 10%, just that statement, and it got increased by 10%. So you see, when we get to that level, then you can see it. So when we involve them, but I think as a minister, from my little experience now, whatever we do, I think let's get access. We fortunately access President. Let us explain to them what it implies, what it means. When they understand, in fact, they do the advocacy for us. This is what I believe we should do in form of leadership. And leadership at our own levels. When we look at, we need to look around. Why do we have zero dose children? So we cannot talk about zero dose children in abstract. When we look at the situation in the Gambia, we realize that many of the zero dose children, unfortunately, are in the urban areas. In the urban areas, their mothers are going to the market to make ends meet. Their mothers are actually also going to offices to work. Now, I visited a very busy health center in the urban area. And I also saw the nurse sitting at the table, surrounded by up to 100 women, trying to get the infant welfare child over each other. And no wonder. If I were a mother, certainly I wouldn't be able to come and stand 3 hours here doing this. So what do we need? So we said we need to increase access. We need to build more health posts. And I must say, we put that forward to Gavi, and Gavi bought the idea, and Gavi built 5 health posts for us as a start, as a pilot. And when that was found to be useful, we expanded, and as I speak to you, we are building more with support from Gavi, and we put that forward also to Badia, and Badia is equally building health posts for us, because we say the women and children need to be immunized in dignity, not standing under the sun, under a tree. So improving access will help us reduce the zero dose children. And I said earlier in my speech earlier in the morning, also innovative immunization times. Typically, in many of our countries, women go take their children to the health facilities in the morning. They queue there, and then, but we said some of these women are working. Why don't we do it after work? Why don't we also ensure that weekends, they are able to go to health facilities to get immunization? And that also started and is working, and partners are also supporting. So I think in line with what we intend to do, we believe we should make partners understand this is where we can make a difference. This is where we want you to support. Yes, and sometimes what happens, our own teams at home, when I say A, B, and C, and where I say, oh, Gavi will not support this, Gavi will, I say yes. When I got fed up, I said, please call Gavi and tell them this is what we want. And when Gavi was consulted, I realized that Gavi didn't have any objection. They supported, and we are getting what we want. So I think sometimes we need to strategize. Now, when it comes to the leadership as well, when we do our work plans, it is very important that we focus on the relevant things. Let us focus on, at the program level, focus on buying 4x4 vehicles for program officials all the time. That also consumes part of the money that is supposed to be used probably to buy motorbikes for a primary healthcare worker who will go to ensure that people get immunized in the communities. The strengthening of primary healthcare services. As I speak to you, almost 50% of the population of Gambia, the villages, have primary healthcare services. We are working on primary health care revitalization so that the entire population, 100%, get primary healthcare services. Because if you have a village that has a village health worker, that has a community birth companion, all the villages have this. And then you have in a circuit a community health nurse with a motorbike going to check on these people. And these people live in the communities. They will know which mother is not taking her children for immunization. They will know which child has developed A, B, and C because they live with them and they get trained. And I will use this opportunity to remind DG of Africa CDC, we have written for support in this line, and also know that this is our priority to ensure that all the villages in the Gambia become primary healthcare villages. When it comes to health financing, financing immunization services, I think this is very critical. But I think it's very important for us to know, too often than not, especially the new parlance, is we hear people in fora talking about we have to do domestic health finance, we have to look inwards. And they say it boldly that it sends shivers into me because they make it sound like domestically the monies are lying down. All we need to go is go and pick it up. It's not there. It's the same monies we are using to bring electricity to communities. It's the same money we are using to build roads. It's the same money we are using to put water and sanitation facilities. Yes, we can increase it. But why I'm saying this is that it is important for us to know we still need the partners. We need the Gavis, we need the UNICEF, we need the Global Fund, we need all those partners for the time being. But however, we need to increase commitment. At home, we are building a lot of facilities from government resources. We bought community ambulances. We realized that that child also will have a disease in the community, and they put the child and the mother on a donkey cart to the facilities. Then our president said this cannot be done. Whilst officials drive 4x4s in the town, and the pro mother is on a donkey cart. It's not acceptable. So we bought 80 community ambulances that pick women and children from their homes to a health facility. That is a very, very big innovation, and the monies were from government funds. So government is increasing these resources. But there are many innovative ways we can do. Increase domestic finances from the budget. But the partnerships are also important. We recently had the Gavi replenishment round in Brussels. I was fortunate to attend that. I sat down one day and I said, Gavi is doing this at a global level. Excuse me. I didn't see many African donors at that forum. I said, why don't we also sit down? Let us do it at country level. Gavi, think of this and bring countries together. Each country has Gavi focal people. Let's work with the countries. For example, Gambia. We say we are doing another cycle of funding, and we do fundraising in Gambia. We invite people, and believe me, that will yield results. So that is an idea for Gavi and the countries. Because when we do fundraising for political parties, either ruling parties or opposition, they get funds. So if we do for immunization, and we coordinate it with international partners like Gavi, and believe me, we will get some few millions to spend on immunization. So we task you to work on this. Finally, I know I've gone beyond the 5 minutes, but I think it's also very important to harmonize and have very strong partnerships. Let's look inwards to support countries within our region. Vaccine sovereignty is typically important, but let's find avenues whereby entities, if the Institute Pasteur is providing the vaccines, now Gavi, you buy the vaccines, buy from them. Since you buy for us, UNICEF, you buy from them, and then the capacity will be built. If we want sovereignty, these are the difficult decisions, Africa CDC, all of us, we need to come to the table and talk about it. If we want domestic manufacturing to prosper, we have to make deliberate efforts to support them. Otherwise, they will collapse. the little capacity will be there, and then the revenue will all be exported out, and then therefore the domestic manufacturing cannot be supported. So I think this is very important. We need to work together, support each other as a continent, and so that we move forward. Because people can help us from outside, but they cannot build Africa for us. That one, we have to put it at the back of my mind. Thank you very much for the time being.
Thank you very much, Excellency. And I think you've been very comprehensive. We haven't touched to the next two presentations on financing and local manufacturing. I think that's the reason why the next presentation, instead of taking one by one, I'll suggest that the two presenters prepare to combine them so we give them at once. Now, with that, I would like then to invite our next speaker, who is Dr. Augusto Gomez, the Minister of Health of Guinea-Bissau.
Obrigado. Obrigado pela oportunidade que nós vamos ter agora, sim, nesta segunda fase da nossa conferência, do nosso fórum, para falarmos sobre os
As a
desafios
forum
da cobertura vacinal
sur
nos nossos estados.
the challenges
Das
of
crianças 0-12
immunization
continua a ser
coverage, the issue of
uma grande
zero
preocupação
dose children continues to
da
be a
saúde
big
pública nos nossos
interpellation of public
Se
health
olharmos
in the states. If
pelos dados, pelos indicadores,
we take the data
chegamos à
and
conclusão
indicators,
que, efetivamente, o nosso
we come to
futuro
the conclusion that our
pode
future
ficar comprometido se nós não evoluirmos no
can be
sentido de
jeopardized
inverter esta tendência.
if we don't move
A Guiné-Bissau
towards
é parte crítica
reversing
desta
this trend.
dinâmica.
Guinea-Bissau
Voltamos aqui
is
a saudar
part of this dynamic, and that is why we want to command this
agradecer
forum
o
and
patrocínio
thank
das autoridades do Senegal
the high
ao
patronage
assumirem
of
a
the
coordenação
Senegalese
deste fórum
authorities
e o suporte que nos tem
for
acordado.
hosting
A
this forum
Guiné-Bissau
and the support
solicita isso e agradece.
given to us. Guinea-Bissau
A
commands this and
imunização,
thanks
como
you.
dizemos na
Thanks
nossa
you.
primeira intervenção,
Immunization, as
não é
we said it in our first
é um
intervention,
investimento no futuro.
is not
Portanto,
an
é
expenditure, it is an
investimento no ser
investment
humano, é investimento
on the
no
future.
homem e
It
na
is
mulher
investment in
dos
human
nossos países
capital,
e da nossa região
investment
africana.
in men and women in our countries and in our
Portanto, nós
West
pensamos
African
que
sub-region. So we believe
o exemplo que temos do Senegal
that
deve
the
ser
example
retomado por todos os chefes
which we have of
da
Senegal
nossa
must be
região, no sentido de
taken
assumir
up by
nas
all
suas
the
agendas
heads of states of
presidenciais
our
dos estados
sub-regions
a questão
to
da
have
imunização
in
desde a
their
primeira
state
fase
agenda the issue
como
of immunization from
futuro
the
dos
first
nossos
phase
países.
of men and
Portanto, o
women for the
investimento
future of our countries.
na imunização e na
So
dotação dos recursos do
investing
futuro
in
são contributo
the
para o crescimento
immunization is investing in the future human resources.
Portanto, este
This
fórum
is a contribution for the
deve
growth of
produzir
our economies.
recomendações que possam levar
These
ao
forums
reconhecimento
should
que vale mais
produce
prevenir
recommendations
do que remediar nos
that
nossos
says
em
better
relação à
safe
questão
than sorry with regard the issue
Portanto,
of health.
nós saudamos esta iniciativa
We command this
e fazemos
initiative
dela uma excelente oportunidade
and
para o
we are
virar
going
da
to make
página
of it
na abordagem
an
da
excellent
saúde dos nossos
opportunity
estados, em termos da
to
governança.
change the
Às
paradigms
vezes,
of health
é
approach in
difícil
health
ser ministro da saúde
in
nos nossos
the
estados.
governance of health Sometimes it is difficult to be a minister of health in our states because the distribution of the budget in this sector and financing continues to be a challenge. When this forum proposed to bring together the ministers of health and finance is a brilliant idea because the ministers of finance of our countries have a delicate and difficult role to play on how to implement the priorities expressed and materialize them. Sometimes the government do not have the capabilities to translate into practice the political priorities in the area of health, and that is why we believe this Dakar Forum must be a way of doing advocacy to our heads of states so that they make of public health, the public health of our countries their lead agenda. When the heads of states will endorse that and that paradigm shift will materialize, the governments with all the tasks ahead cannot do multiple priorities, especially in the area of health. We believe that if we want to do well, we can make of the Dakar Declaration a platform of change by conducting this advocacy at the highest level, at the level of the President of the Republic, by basing ourselves on the will expressed by the President of the Republic of Senegal, His Excellency Bassirou Diomaye Faye, to his colleagues and peers. We should strengthen financing on the population's immunization activities, taking into account today that mobilizing external resources is a challenge, is difficult to face. So we must focus on domestic resources to be self-reliant and achieve this national, sub-regional and African paradigm, and result-based financing can be a strategy that could yield concrete results in the paradigm shift of our states and our sub-region. In Guinea-Bissau, even if we are starting the governmental exercise as a Minister of Health, we believe this articulation is key and for the paradigm shift. We are starting to launch a One Health approach by bringing together animal health, environmental health, and human health to make it a sustainable public health capable of facing the external challenges. So we express our solidarity with the Gavi initiative, the Africa CDC initiatives with the international partners supporting our states, knowing that we cannot wage that battle alone. Together with our traditional partners, we can do this, but it is very important that African countries and government take in their own hands the objectives and strategies that can impact and lead to concrete results to the benefit of our populations while being supported in order not to live in a total dependency. The production of vaccines and drug product is a challenge in Africa. We must all align for the materialization of this to defeat once and for all, together with the international partnership, that war. This is our belief. We understand there is the obligation to have universal coverage to the benefit of our populations and children, and leave no one behind. I would like to conclude by saying that finance and health must be together so that men and women be taken good care of in the future Africa. Thank you.
Much, Minister. Those are very important points that also have touched to the issues of finance and local manufacturing that we are already taking, I think, to also enrich the presentation and the input on those two topics. Now, with that, I would like to, je voudrais maintenant inviter les...
I would like to invite Honorable Martha Morris, Deputy Minister of Health in Liberia. Honorable Martha.
Thank you very much. I know I got 5 minutes, but I would like you to permit me to recognize few important people in this room. Dr. Abraham Ansai, Minister of Health and Public Hygiene, Senegal. His Excellency Dr. Jean Kesia, Director General, Africa CDC. Mr. Gilles Fanillon, Regional Director, UNICEF West and Central Africa. Dr. Amadou Lamine Samatek, Minister of Health, the Republic of Gambia. Dr. Augusto Gomes, Minister of Health, Guinea-Bissau. Mistress Moham Mariama Alhazin, Ambassador of Niger to Senegal. Dr. Rigid Mihingo Gavi, Representative, Global Fund, and WHO representatives, delegates, distinguished ladies and gentlemen. It's an honor to sit on this platform with senior colleagues, honorable ministers of the health system of different countries. I'm honored. I bring greetings from the Minister of Health of the Republic of Liberia, Dr. Louis Mboto. And it's an honor to participate in this historic event, this high-level forum of immunization that is aimed at securing political and financial commitment to sustainable domestic financing for immunization in Africa. Dr. Mboto would have loved to be here, but because of computing priority schedules, I'm here representing her. I want to say thank you to the presenter, the technical team. Presentation was great. And I would love to share some experiences from our country, Liberia. When I heard my senior colleague, the Minister for Gambia, speaking, it was like Gambia and Liberia have Gavi as one of their best supporters. In Liberia, we have done a lot to strengthen our coverage, widen our coverage in capturing our zero-dose children and under-vaccinated children. How have we done that in Liberia? We have worked along with the community health workers who are deployed in the various communities to identify zero-dose children and refer them to the health facility to be vaccinated by the health workers assigned at the facilities. We have also, through the support of Gavi, we recommended that we needed motorbikes for our vaccinators, and Gavi bought that idea. So we want to say thank you to Gavi. Motorbikes were bought, procured, and given to all of our vaccinators. They go out for outreach on a weekly basis beyond even the 5 miles to be able to identify and capture the zero-dose or under-vaccinated children. And that has worked very well for us. When this government, the new government we have, took over, we took over a system that was heavily challenged. But because His Excellency is committed, His Excellency Joseph Yuman Boaga is committed to ensuring that zero-dose children are captured. The health budget was added for the budget year 2025, and even more to be done for 2026. We have worked with the lawmakers, and they are all in support. We are collaborating very well, working along with the finance ministry. And every meeting we go to, the case is there. First example, who all in this room? If anyone in this room was not well, they won't be here at this time. And that message is resonating very well with all of the entities. We are here today to also recommend and encourage fathers, because we know how powerful fathers are. We have observed that vaccination has been left with mothers across. But fathers need to get included. Fathers need to be active in ensuring that our children go for vaccination. We also, as a country, we are enforcing and increasing, accelerating the payment of taxes, because we know on many occasions right now we're having discussions with the Ministry of Health. How can every citizen in the country pay taxes? Whether it is $1, whether it is depending your category. So our government has engaged into that process to ensure that our taxes are collected and protected and safe and well managed and come back to the health system and other systems. We are working with the interministerial committee. We work with the schools. We work with the youth and sports. We work with the Ministry of Gender. We work with every other line ministries and agencies that are important into this process, because we know that those children are the future of our country. I will also want to say to you that we have integrated our immunization into our primary health care. We have integrated that. Every visit, we have our vaccinators, we have our family health division represented, we have the community health represented. So it's a whole integration, and we have embarked because we know with one team, you make a greater impact. We also have noticed that at the different borders, the mining areas, the concession areas, we had some gaps. We were also able to talk to Gavi, and Gavi accepted that we recruit vaccinators, health workers to go to those areas and be able to provide our vaccination to our children. So we want to again say thank you to Gavi. We are using the DHSI too. Real-time data is what informs policymakers to make decisions. So our DHSI tool is effective, and we get all of our information on time. We are even setting up a new system that will capture every zero dose, every pregnant woman, everywhere in Liberia. Maybe a month or two from now, we will have that system set up. So on this note, we want to say to the world, we want to say CDC Africa, Africa CDC, who have organized this, that Liberia is in agreement with whatever we are going to discuss here and conclude on. We don't want to see any child left behind for vaccine. We want to include and ensure that all of our children, the future leaders, are vaccinated. So thank you very much.
Thank you very much, Excellency. I think those experiences on some of the successes from Liberia are very well captured. We'll make sure that they are reflected on the community approaches with the mobility, on the community engagement with the particularity of bringing men into it, on the financing also of the local taxes. All those are important experiences that are going to be captured. Now, I would like to invite our next presenter, who is the Vice Minister of Health of Sierra Leone, Professor Charles Senesi, online. Prof, I don't know if you can hear us.
Yes, I can hear you very well. Can you hear me?
Yes, we can hear you. You have the floor.
Thank you. Thank you very much. I'm our able moderator and colleague ministers from the various countries, and also members of the high table, and our DG for Africa CDC, distinguished ladies and fellow participants. I bring you greetings from Sierra Leone. And apologies, I couldn't join you physically, but thank God with the internet, like a global village, so I'm able to join you and share some thoughts. And I followed the whole of the presentations since the past days, and it's been really excellent that the African CDC has taken this on board together with our government. And I followed Professor Njai's presentation. Indeed, we need to have a lot of commonalities among us to push this agenda of vaccination and immunization, especially as it regards to zero-dose children. And governance plays a key role. I can remember my president, His Excellency, retired Brigadier Dr. Julius Madabi, was in Brussels for the replenishment of Gavi and gave a lot of political support along with other world leaders. And then even in Sierra Leone, coming back locally, I will talk more about that. The Minister of Finance is our best friend as our Minister of Health, as it was also alluded to in Malawi when we are there for the WHO Human Resource Conference. It's very important that at political level we align very well because it makes things go a bit faster. And so I will talk more about that after the presentation on the financing, especially domestic financing, and our innovative ways in Sierra Leone. We think we can also push the immunization agenda. But in the area of integration, it's very important that it's re-echoed again in this August body that the primary healthcare is the way to go. In Sierra Leone, 80% of our investment is in primary healthcare, and the EPI is well embedded. In fact, we have only one platform for all vaccines in Sierra Leone. That's the expanded program on immunization, the EPI, which is embedded in the primary healthcare level. And then we have access is very important as well, as my colleagues have already alluded to. And we have a health facility within a 3 to 5 kilometer radius. It's very essential that we achieve that to make sure that we have the requisite facilities. And what is also, I would like to be added to our recommendation is that energy. Most of our health facilities in Sierra Leone and which can be replicated around the globe, especially in Africa countries, we have summer all year round. So we use a lot of renewable energy, solar energy. Almost all our 1,000 to 700 facilities are going to be solarized to make sure that we have constant energy all over the country. And with that, capturing data in real time where you have sustainable energy, capturing data in real time becomes even more plausible. And that's exactly the way we are going. All our maternal, 80%, 70% drop in maternal mortality right across the country was achieved. We have been digitalized. All our 350 to 400,000 pregnancies are being captured on the dashboard we call the Press Track or Kumra app. The situation room is there for anybody to visit us in Sierra Leone and have a feel of how we monitor pregnancies right across the country. Not only stopping that, even our immunization, the children, we developed a new app we call the Pekin app. It combines immunization and nutrition to make sure that we capture real-time data of the children being immunized. So we shy away from the paper-based ways of doing things. We got to learn this because we take healthcare as close to the people as possible. We leave our offices in the headquarters to go as ministers to the villages. We call it spotlight on the district. So we sit with the local healthcare workers, we go through their records, and we realize over and over again that digitalization is the way to go. Capturing the data in real time instead of paper-based is the way you can go small baby steps, and we will definitely get there. And even improving access will be a challenge. We buy ambulances. We try to take the vaccines to the least people in the villages. But when you have riverine areas, waterlogged areas, ambulances don't get there. So we have innovative technologies now to make sure that we have boats that are going to use renewable energy using both fuel and solar to make sure that they don't run out of fuel. And with that, we use solar cold storage facilities on board this boat to make sure that they have the cold chain is maintained, and we take the vaccines to the least person in the riverine areas so that we can capture all the zero-dose children in those areas where the regular ambulances don't go there. And then I think that's also something very, very important. I think I will stop there so far. I don't want to go over my time because I think 2 more presentations are coming where I will talk about domestic financing, our innovative ways in Sierra Leone we think we can share with the world on how we go about domestic financing, which may have already been mentioned. I thank you very much.
Thank you very much, Minister, for sharing with us those experiences from Sierra Leone. Now, I would like to invite our last speaker, who is Dr. Godwin Tadom from Nigeria. You have the floor.
Thank you very much, Mr. Moderator. I want to align with the Deputy Minister of Liberia, who has already established protocol to save time. And I want to also bring the apology of the minister who just came back from a trip on Thursday, and he felt traveling again would be too overwhelming for him, and he had asked me to come and represent him. He also asked me specifically to thank the African CDC, His Excellency Jen Kaseya, and his team for the good work they are doing. And he said he will also personally communicate this to him. Nigeria has a population of under 5 children of about 32 million. And altogether, we have about 32,000 primary health care facilities. Just 2 days ago, the country launched the National Demographic Health Survey of 2024. It was unveiled in the ministry. And unfortunately, the summary of the survey, which was conducted in 2024, showed that though we have made progress generally in reducing childhood mortality, but when it comes to immunization, 39% of children aged 12 to 23 months were found to be fully vaccinated against all basic antigens, and only 20% were fully vaccinated according to the National Health Schedule. And also, 31% of this population have not received any vaccination at all, which is still a major challenge that we are trying to. Coincidentally, we have the Minister of Health, our Minister of Health, and the Minister of Finance. They are the two ministers named the coordinating minister. Our Minister for Health is the coordinating minister for Health and Social Welfare, whereas the Finance is the coordinating minister for economy, for finance and economy. And they've been working together. Also, like our minister from Gambia said, you need a strong political commitment to be able to do anything in health. And it has to be purpose-driven. The leadership has to be purpose-driven. And again, we have to set realizable objectives and targets also. Where it works well is the issue of innovation. We have to do things in a different way. Like he said, if you continue to do same thing and expect a different result, something must be wrong somewhere. And also, data collection must be prioritized. Nigeria is trying to put all this to play to ensure that we change the narratives. One of the things that the country has been able to do is the establishment of Basic Health Care Provision Fund. This is 1% of all the consolidated revenue of the country, which is targeted at providing or filling the gaps in health. It's a basic minimum package of health, and most of these resources go to primary health care revitalization. And like has been emphasized most of the time, promoting local production of these products. Unfortunately, when you think of a country with a 32 million under 5, it's huge, both in volume and in number. And of course, you need to provide for all of them if you really want to achieve a good result for your country. And again, importantly, introducing new strategies to reach the unreached. Nigeria has been faced with security challenge for quite a while, for over 20 years. And this covers areas where we've had challenges in immunization, and that's the northern part of the country. Early this year, the coordinating minister of health in Nigeria initiated a new move, which is the Lake Chad Basin Commission, bringing in all the other countries that share boundary with Nigeria. These include Cameroon, Central African Republic in a way, Niger, and Chad, to commence a synchronized polio campaign. realizing that we all share the same challenges, insecurity, and how to reach places. And this joint commitment has several objectives. And one of them is to ensure that we cover all the populations that have never been covered on vaccination. And also to promote that people accept. There was a time in Nigeria where it got to a point where people were assaulted and some killed in the process of trying to administer vaccination. And through the Primary Health Care Development Agency, the country has started improve community mobilization as well as awareness creation across the country. And also, communities, facilities have been empowered through the loans we've collected. The country has been able to access some loans from the World Bank, and this is also used in a way to ensure that we are able to bridge the gap or reduce the gap along the line. So all these put together are the efforts of the government in ensuring that we reduce the challenge, and also, like has been said earlier, that Nigeria is having over 2 million unreached children, to ensure that we bring this number down and most importantly, to start the local production of vaccines, which has been a major drive of the coordinating minister to ensure that vaccines are produced, if not in Nigeria, but in the West Africa, and let there be a hub where we can always access our vaccines. And another thing, most importantly, is that de-emphasizing. We have received a lot of support from our partners, yes, but the minister's agenda is that we should think less of the partner support and look inward, how we can generate additional resources and also create a model of raising resources to ensure that we fund our vaccines directly. I think these are the few things that we have been able, like I've mentioned, the collaboration between the coordinating minister of health as well as the finance, which has also led to increase in the budgets now allocated to health, though we have not reached the 15% mark, but the way we are going, hopefully we'll get there. Thank you very much.
Thank you very much, Director. I think we've gotten to the end of this first segment. I think 5 very important points that have come out of the discussion, I think, for the Secretariat. One is that we have heard les excellences, les ministres qui ont vraiment mis un accent sur l'engagement politique de haut niveau qui est indispensable pour la réussite de tous ces efforts d'amélioration de la vaccination dans la région. Donc ça, c'est un point extrêmement important. On a entendu qu'il est indispensable que cet agenda soit porté par le chef de l'État et il est indispensable qu'il y ait une bonne collaboration entre le ministre de la Santé et le ministre des Finances. Ça, c'est un message qui devait ressortir très clairement dans notre communiqué. Et la deuxième chose, c'est aussi en rapport avec cet engagement-là, c'est le type d'engagement. Un engagement qui regarde surtout aux problèmes d'équité. Donc, l'équité sociale en rapport avec les segments de la population, c'est rassurer qu'il n'y a pas des oubliés dans nos populations. Et la deuxième chose, c'est l'équité territoriale aussi, pour se rassurer qu'il n'y a pas de zones géographiques qui n'ont pas d'accès et qu'on n'arrive pas à atteindre. C'est rassurer que tout le monde est atteint, que ce soit en termes de territoire géographique ou en termes de segments de la population. Ça, c'est le premier point extrêmement important en rapport avec l'engagement politique. Le deuxième point important, c'est en rapport avec l'engagement de communauté. Comme vous le savez, on ne peut rien faire pour les communautés sans les communautés. Donc, c'est important que nous puissions assurer, continuer à mobiliser, à sensibiliser pour une bonne acceptation de la vaccination sans hésitation. Mais on a entendu aussi que même parmi les acteurs, nous devons nous rassurer que les pairs aussi font partie des acteurs principaux en matière de la vaccination. Le troisième point qui est ressorti très clairement aussi, c'est le besoin de renforcer les soins de santé primaire. On a entendu, leurs excellences ont beaucoup insisté sur ça. C'est renforcer les soins de santé primaire, d'une part pour s'assurer qu'il y a un accès suffisant, comme le ministre de la Gambie l'a même dit, accès avec dignité, donc au service. Mais c'est aussi assurer qu'il y a tous les moyens de mobilité quoi qu'il faut mettre là-dedans. On a entendu les ambulances, on a entendu les motos, donc de façon à ce que tous les moyens soient mobilisés pour qu'il n'y ait personne ou aucune communauté qui est laissée pour compte. Et dans, dans ce renforcement des soins de santé primaire, à part l'accès, il y a le problème de la digitalisation qui était déjà reflété par Dr Tandara, mais il y a eu un accent aussi sur deux éléments importants. Dans le discours du DG, il a parlé de la connectivité. Et dans l'intervention du Libéria, de la Sierra Leone, on a entendu aussi l'importance de l'énergie, donc surtout l'énergie solaire dans des coins où l'électricité ne peut pas arriver. Donc ça renforce encore que le renforcement des soins de santé primaire, avec cet agenda de digitalisation, de connectivité, de solarisation, c'est un élément important qu'on veut bien voir refléter à ça. Un quatrième point qui a été aussi mentionné, c'est la question de financement. On a entendu clairement que nous devons d'une part mettre l'accent pour continuer à mobiliser les ressources domestiques. Hein. On a entendu qu'on est encore loin de la cible d'Abuja, mais on a entendu aussi des expériences que ça ne doit pas se limiter seulement au gouvernement. Donc on doit aussi regarder toutes les opportunités qu'on a localement, les sociétés d'affaires qui sont dans nos pays et d'autres financements innovants que l'on peut aussi considérer. Parce qu'on sait que nos gouvernements n'ont pas une enveloppe fiscale qui est illimitée. Donc, il faut vraiment mobiliser le maximum possible à travers même des sources non gouvernementales, parce que ce sont des ressources qui sont déjà au niveau de nos pays. Le quatrième point, c'était en rapport avec le partenariat. Qu'on a besoin de ces partenariats, il n'y a pas de doute. Mais ce qui est important, on veut vraiment un partenariat qui est aligné derrière les priorités nationales et un partenariat qui peut donc apprécier les stratégies que le national identifie comme la meilleure façon de pouvoir résoudre les goulots que nous avons. Donc ça, c'est extrêmement important. Bon. Et puis, le dernier point, c'est en rapport avec la production locale de vaccins. Un élément important que nous devons tous vraiment nous rallier pour accompagner cela, parce que la grande question, c'est la question de créer le marché, donc de créer le volume pour encourager la production locale. Et ça, il y a un engagement de tous les États membres qui doivent se mettre ensemble pour acheter ensemble et acheter local. Donc, c'est vraiment important qu'on puisse mettre cet accent-là. Mais aussi, comme on a entendu, que nos partenaires aussi, comme Gavi, comme l'UNICEF, puissent aussi nous accompagner en achetant ces produits qui sont manufacturés en Afrique. Donc, c'est leur façon aussi de soutenir cet agenda de la manufacture locale en ligne avec ces réveils et ces mouvements de souveraineté qui est en train de se développer sur le continent. Donc voilà quelques points, 5 points importants que le secrétariat peut voir. Comment est-ce qu'on peut nous rassurer que ces points-là sont bien reflétés dans les communiqués et surtout dans les recommandations qui vont ressortir dans le rapport final de cette session. Donc avec cela, je voudrais que nous puissions applaudir fortement nos intervenants ainsi que le professeur Tandara qui a fait la présentation. Voilà, donc maintenant nous passons à la deuxième partie et la dernière. Comme on a suggéré, il y a beaucoup de points qui sont déjà ressortis qui concernent ces deux présentations, donc on ne va plus répéter, ce qui fait que cette session sera un peu courte, espérant qu'on va juste se concentrer sur des points additionnels qui n'auront pas été couverts pendant ces premières interventions et aussi dans les présentations que nous allons écouter. Donc je voudrais inviter donc Dr Landry et Monsieur Chiluba de pouvoir s'avancer pour nous faire ces présentations. La technique peut aider à mettre les diapos en mode présentateur.
Can the technique
Voilà.
display the presentation?
Your Excellencies,
Excellences, Monsieur les ministres et Monsieur le directeur général,
guests in the room and online, allow me to just write on the protocols observed by the previous speakers. My role is to present to you the landscape of vaccine manufacturing and also briefly talk about some reflections that were discussed in yesterday's engagement. Next slide, please. Okay, we seem to have a technical challenge. Not sure if this is working or not. If you could put it in presentation mode. Right. Okay. Now you can go for it.
On peut changer de machine. Yeah, please go ahead in the interest of time. Huh?
I'll just open my computer quickly. Great, it's moving. Thank you. So yesterday's conversation started by reminding ourselves of the current situation. So this is where we are as the manufacturing of health products is concerned. So we note that we're still importing 99% of the vaccines that we use on the continent. And if you talk about diagnostics and therapeutics, we have 95% of diagnostics still being imported, and limited therapeutics manufacturing capacity, which focuses mostly on basic formulation and packaging, and not so much on API production. And by extension, if you go to vaccines, again, we also see that a lot of manufacturing at the moment focuses on fill and finish. Based on these statistics, the African Union set an ambitious target to manufacture 60% of its vaccines by 2040. Since the COVID-19 pandemic, I think we have seen significant investment interest in vaccine manufacturing. And as of 2024, there were 25 active African vaccine manufacturing projects. We categorize the current projects into 3 segments. We have the segment 1, where we have the African vaccine manufacturing companies with facilities already installed and have technology transfers agreements signed. Segment 2, we have the facilities that have been installed, and these are awaiting signing of technology transfer agreements. And then we have the last segment, which are the least developed projects, which are working on establishing or installing the facilities in the process. So I think based on this, we can conclude that there has been a positive response to the call by the African heads of state to make sure that we begin to manufacture our own vaccines on the continent and drive towards the agenda of manufacturing 60% of vaccines on the continent. Related to the same, we expect that about 8 antigens will be WHO PQ'd over the next 5 years. That's between 2026 and 2029. And this slide is simply just trying to show the projected African demand for the various vaccines that are expected to get onto the market and how they are currently procured for the member states. The success of vaccine manufacturing industry is highly dependent on sustained demand. And I think this has already been alluded to by Dr. Ngashi. We see that if we do not create deliberate mechanisms for us to support the industry, the significant investment and strategies that have been developed over the past few years and those yet to come risk not realizing the expected fruits. So the manufacturers require that there's clarity of demand for them to put in place business plans and ensure that they do not have significant challenges for them to be sustainable. Where will this demand come from? I think if you have a look at the various enabling factors, which I'll show shortly, one of the things that we really do have within our powers to create is the demand. And so the African country decision makers will need to be deliberate in making this decision to buy local manufactured vaccines, but also global procurers through tender allocation based on country choice. And we have seen some of these initiatives beginning to be implemented, for example, Gavi. So we can establish demand effectively. Right now, what we are asking is that we need to start thinking through how procurement decisions and the decision makers can collaborate to support appropriate demand offtake for African vaccine manufacturers. So the message has been very clear. The leadership has put itself on the line to support or put their commitment to the agenda of local vaccine manufacturing. And if you get to see the various engagements that have been spearheaded by Africa CDC, we see that from 2022, leaders committed to investing in local vaccine manufacturing and building resilience for future pandemics. In 2024, last year at the World Health Assembly, the ministers pledged to support the purchase of African-made vaccines to build sustainable industry. And then earlier this year at the Africa Health Product Manufacturing Forum, again, that call was made urging the member states to prioritize African-made vaccines and set up clear ways to show this preference in procurement systems. So there's no question of commitment at this point. We have seen a lot of commitment, political pronouncements. I think what we now need to move to is getting to actionable measures that need to be put in place. And so here we see that African-made vaccines should be prioritized in different member states or across the continent. And Africa CDC with its partners is making itself available to support the member states to ensure that there is a clear, accessible information on upcoming African-made vaccines, and also supporting the governments and expert groups in making informed procurement decisions. We have made a few recommendations regarding this, and the recommendations that have been made are based on the various discussions that were made. I think the first one relates to ensuring that there's now implementation of the policies that support procurement of African-made vaccines. And secondly, implementation of regional procurement mechanisms and support for the African food procurement mechanism that is being established by Africa CDC. We have also noted the need for us to really look at the entire ecosystem. I think yesterday from IPD, there was a mention of the need for support industries to be really established. And here we're talking about aspects of raw materials and packaging. There was also a call that there's need for us to have an ecosystem that supports R&D and workforce development to support vaccine manufacturing ecosystem on the continent. And in all this, I think we are asking for us to be moving from simply the commitments and announcements, but going all the way to implementation and allocation of resources required to implement these recommendations. Thank you.
Thank you very much, Chiluba. Can I please invite Dr. Landry then to follow up with the next presentation?
Good afternoon. Let me stand on established protocol and move straight forward to the presentation. The third theme of the introduction to the panel relates to a topic which, since this morning, has been at the center of all the key remarks from our leaders. Is the one on financing. So let me, je voudrais, s'il vous plaît,
I would like, if you allow, present on behalf of the technical experts the summary of our discussions, starting with this slide, which is not maybe up to date. We were all very happy to learn from Nigeria, for example, that Nigeria is now one of the countries that reached 15% domestic budget allocation to health. So this slide is not up to date, but it described the situation on our continent and in our region in West Africa regarding the allocation of national budget to health. We have still some way to go to reach the 15% of the Abuja.
The second point, which was highlighted around health, pertained to having a better understanding of what the General Director of Africa, CDC, Dr. Jean Cassé, said or called the Green Book this morning. The Green Book for Africa's health financing in an era. We have discussed all three pillars. The first one being on domestic finance and highlights the importance of having or developing local context-informed plans. It also looks at looking at new funding mechanisms. This first pillar on domestic finance is aligned with the Abuja Declaration, which aims for 15% of national budgets being allocated to health. We've also talked about the second pillar regarding innovative finance. We've had many conversations around different options in this regard. The first one being diaspora and contribution. We know that across the continent, West Africa is one of the regions with the strongest diaspora. Innovation in terms of diaspora contributions should be sought out at the national and regional levels, and Africa CDC should explore this in the context of continental innovation. The third pillar pertains to blended finance. And in this regard, we were highly impressed by the suggestion from the Minister of Health of Senegal, Dr. Ibrahim Essi, whom insisted on mobilizing the private sector so that they can play an increased role in investment, especially in terms of infrastructure and local production. Our conversations then looked at what we could do before we achieve these targets. This is how we've designed ideas to increase efficiency for ongoing immunization programs. Excellencies, we've also discussed on what the Lusaka agenda means. This morning in the conversations, we've talked about this, and we've designed and explained the 5 major changes to the Lusaka agenda. We've all agreed that in the future, immunization programs should be examples for the implementation of the Lusaka agenda. National integration of immunization in primary healthcare policies should be seen across the continent, and we should see increased coordination between countries. Of course, undoubtedly, we're all aware that continental coordination of the Lusaka agenda is spearheaded by Africa CDC, and our heads of states expect an implementation report every year. Then we've talked about different discussions, or we've had different discussions on previsibility, budgetary execution, support fragmentation, capacity analysis, and capacity monitoring. Then we've talked about the high or over reliance on external funding. We've also issued recommendations for innovative mechanisms and sustainable mechanisms. We've talked about dedicated funds. We've talked about taxes such as micro levies. AfriVac has shared a few examples. And we've also talked about diasporan contribution, as I've said. We then talked about performance-based finance. Given that we are scarce on time, let me quickly summarize the main recommendation. When it comes to governance and political leadership, we're not going to go into more detail on this, more than what was done by our leaders this morning. Immunization should be explicitly addicted as a national priority. And this can then translate into development plans and national budgetary allocations. Then we have translated permanent dialogue between the Ministries of Health and Finance into tangible cooperation. This is what we've been doing. And in translating the Lusaka agenda, we wanted to insist on an alignment framework using local funding mechanisms so that we can allocate external funding to health. Excellencies, regarding domestic funding and innovation, we would like to suggest that in West Africa, the implementation of the Lusaka agenda, as well as the Green Book pillars, be an emergency. This means that we have budgetary envelopes in order to increase national budgets allocation, and beyond the 15% of budgetary allocation to health, we must also guarantee that primary health budgetary allocation be planned. And we suggest that 50% of health budgets be dedicated to primary health care, which would include immunization. Finally, beyond innovative funding, as I've already described, we would like to suggest that including vaccines must be done in accordance with the midterm frameworks. This is, in summary, my presentation. Thank you very much. We would like to thank Dr. Landry as well as Mr. Chumba for these two presentations. And as we have already discussed, I believe so many measures to implement so that Africa can be ready to commercialize African products. When it comes to funding, we have two objectives. On the one side, we want to increase resources available for health, and on the other hand, we want to optimize the use of readily available resources for greater impact. So these recommendations aimed at doing exactly that. On this note, We are going to turn towards you once more to give you the floor, His Excellencies.
Please permit me to make a correction. Maybe it was an interpreter's error in a way. Nigeria has not reached 15%.
Yeah.
We're only aspiring, but we are not there yet.
Yes, I think, thank you very much. That's on Landry's presentation. Very well noted. Now, I would like to start online. Prof. Charles Senesi, I don't know if you are still with us.
Yes, I'm here. Yeah, I'm here.
Prof. Charles, are you still connected?
Yes, please. I'm still connected.
Yeah, I think we'd like to give you the floor first.
Oh, thank you very much, our able moderator and ministers of health, our DG for CDC Africa, and distinguished ladies and gentlemen. Thank you very much again for giving me the floor. And I would also like to recognize our Minister of Finance, one in the audience, Honorable Kadi Ali. I think she's somewhere in the audience because what I'm saying will have direct relationship to her Ministry of Finance. And indeed, starting with the local manufacturing, it's really very, what can I say? When I saw the statistics, 99% of what we consume, we have to import. And then, which is very correct for Sierra Leone because we only manufacture hand sanitizers and oxygen. Everything else we have to import. And even 99% of diagnostics, we have to import. And I was also in touch with Dr. Lange back in Addis about some of the diagnosis tests we use, especially the RDT for malaria, which is 100% imported, but it's really not serving the purpose. It doesn't quantify the parasites, which is not what we want. But local manufacturing is the way to go. We need a lot of political commitment. We need countries, regions have to create an enabling environment for us to develop that vibrant. We need it as early as yesterday, local manufacturing. And then even when pandemic strikes, it's when it hits hard. So we really have to prepare ourselves very well to have that local manufacturing. Political leadership, governance is very important to make sure that we create the enabling environment in terms of lands, in terms of waivers. I think we discussed this in several forums. And that's very important. And again, when we manufacture, we should be able to store them to maintain that stability, to maintain that shelf life. And there again, I come in again with renewable energy. In Sierra Leone, we are building a warehouse, a farmer-grade warehouse, purely on solar energy to make sure that it is sustainable, to maintain the shelf life of the product and maintain the good distribution practice, as we say. But again, apart from the political, coming to the technical and scientific level, we need to do a whole lot as well as scientists and technical team. And then I'm happy that the Minister of Health from Gambia, they used to have very innovative ways of technology. I worked there in Gambia for a while, and I got across all of the countries in Africa I've worked in. We need to engage and empower the young scientists to make sure they provide the evidence upon which we can stand upon in the research and push for local manufacturing. Because even being the best friend of the Minister of Finance, if you don't have evidence to afford them to stand on that decision and give you the requisite resources, material, financial, and human, it becomes very challenging. And in the area of domestic financing, so the last one is very, very important for us. And even in Sierra Leone, I see there was a long list of possible areas of financing. Indeed, even we are even putting taxes on some of the goods that bring health problems. We call them sin taxes. I think it resonates right around the country of tobacco, alcohol, sugar drinks. I think we are taxing them to put that money aside and invest in healthcare. And I trust it's going to be a lot of we go into primary healthcare, that preventive strategy to make sure that our people of Africa do not come down with the diseases, they don't communicate with diseases and others associated with this one. And I'm very happy we spoke about the health insurance. Sierra Leone also, like most African countries, we are now going towards it. The health insurance scheme is well advanced. It's the way to go. It will take a while for us to stand on our feet, but let's start with baby steps. And the diaspora. Most of us in this room where we are, we must have a diaspora. Our definition is that if you leave your country of origin, You go out even to the neighboring country, you work or study, you decide to come back home, you are a diaspora. You had a choice to stay where you went, and you can contribute sustainably, which is what most of us before coming as ministers, working all around the Africa continent, promoting diaspora engagement to make sure that we bring to our continent, our countries of origin, the skills we have acquired along our journey of life. We know our roots, we know our areas best, like the Africa cities is leading for the continent, for the healthcare of Africa. That's very important, and I support the issue of the airline ticket, something most of us have not thought about, but it's the way to go. And I like the ambitious plan of the primary healthcare CDC guide, Dr. Lange. 50% of health and things should go to primary healthcare. 80% of hours in Sierra Leone goes to primary healthcare in terms of allocation, and it is really to go. If we tackle diseases at the primary healthcare level, even for pandemics, they start to begin in the communities. So if we invest a whole lot in primary healthcare, innovative way like my colleague minister for Gambia and Liberia said, I think it's one of the best ways to go. And I really support that it gets into our recommendations. I thank you very much.
Thank you very much, Excellency, on those 4 important points. Now I'd like to invite Honorable Martha Morris.
Thank you. So I will start with the production of vaccine. Again, with the emergence and re-emergence of vaccine-preventable diseases and diseases that are of public health concern, Liberia stands to support this process. We are aware that a lot of our countries, Liberia is of no exception, is not well equipped with the right infrastructure. So we will recommend that as other countries of this region or the continent may be ahead of Liberia, we should focus on the development of human resource and infrastructure. When we talk about political will, I would want to say in this forum, Liberia is far ahead when it comes to political will. Our present president, His Excellency Joseph Yuman Boakai, is so supportive of the health system that at this point in time, we are current with our co-financing. When we took over, we had a huge gap of the co-financing for the vaccine. And I think Gavi can attest to that we are current. We were able to clear up to this budget year. So, and we are committed to that to ensure that our government respond and pay what portion of the financing for vaccine is committed. So we are current with that. We also have recruited volunteers because we all know that the human resource aspect of this vaccination, this immunization is very key. We need the workforce to implement. The government of Liberia, since the beginning, have been recruiting those volunteers that have been working on the workflow. So we initiated the recruitment process. We had the first 600 volunteers, and we submitted the next batch of volunteers, 830. The community health workers are all going to be employed by the government of Liberia to ensure that the workforce are satisfied as they implement the health services across the country. Domestic financing. The health sector, Dr. Louise Boto, with her innovation and knowing that Donor fatigue is everywhere, and health cannot be free of charge. We have embarked on the process they call the Community Revolving Drug Fund and the cost sharing. This Revolving Drug Fund is where we have no profit into this, but patients will pay very little amount. And that amount is going to be used to replenish the drugs, and continuously there is no stock out ever will be at any facility. So we have embarked on that, and the citizens of Liberia have embraced the idea, the CSOs, the communities, all stakeholders have supported the idea. So we have embarked on a community revolving drug fund. We also have a second component of that, which is the cost sharing. That cost sharing is also a very little amount, and it's not about profit making. It's only about, for example, if you were to do some little procedure, whatever little that patient has to pay for that procedure, just to revolve materials needed to continue doing other procedures for other patients. We have a project that we call the LEF, which is the Liberia Health Equity Fund. That is a bill that we have drafted, and it's about the insurance. We have drafted that bill, and that bill is right before the president, His Excellency Joseph Yuma Boakai. That draft bill is there, and we are awaiting his response, which we know is going to be positive because we have his backing. I also want to take this time to sincerely thank and appreciate all our partners, Gavi, WHO, UNICEF, Africa CDC, the World Bank, Global Fund, and other partners, both private and the local community, who have contributed immensely to the immunization program in Liberia. We would never have reached the level we have reached without your support. I want to pause and say thank you for this opportunity once more. Thank you.
Thank you very much, Honorable. Maintenant, nous allons inviter Son Excellence Dr. Augusto Gomez pour faire ses remarques.
Boa tarde mais uma vez e reiterar os meus cumprimentos a todos os painelistas que estamos aqui juntos nesta partilha muito importante, todos os participantes, e reafirmar o nosso agradecimento por estarmos aqui e felicitar a iniciativa mais uma vez. Dizer que
want us to be here and commend once again the presentation which have just been done, and as input to that to this last presentation, we have here are the inputs. I would like to talk about domestic funding in the health sector. This requires a strong commitment from the heads of states, and that commitment must be part of the heads of states' agenda in the regional or sub-regional organizations such as ECOWAS. We are asking President Jomai Faye to be our advocate to this community of heads of state. We would like to appraise the diaspora as being an important component to strengthen the domestic financing of health, especially the production and the immunization of our populations. With regard our participation in the last meeting of Abidjan, we had clearly said that we are in line we must look the same direction and work in solidarity and sharing. We must work in pooling together our efforts. And when we pull together our efforts, we can be much more effective. I believe I said it in Abidjan. If we put together our economies and unite our markets and act as one single body and for one health in our region, we should achieve victory. We must not be divided and continue the division that has been imposed to us since the beginning of Africa. So we must now go beyond physical borders. When it comes to health, we must look at our future together. This is my invite, and we would like to command the support from our partners in this fight to strengthening our national public health systems. They must be in line with our national strategies. This way will have positive, important outcomes. So primary health or community health is a key element for the strengthening of our national health system. And to be reasonable, balanced, and fair, this is where we should seed to achieve, to harvest, I mean in community health. We must professionalize the community agenda. We must invest money in these key public health facilities. We must work for inclusion, respect, and respect with the partners intervening in the community sector, NGOs, local powers, religious communities, opinion makers, all the stakeholders in the community systems must be partners. We can also create more conducive conditions for the financing of health in our country by improving the organizational framework through innovation to achieve performance. We must digitalize the system, share the information, have joint platforms of experience change and solidarity in mutualization. The private sector is important to have one health, one single people, one single victory, which will be the victory of the government, the peoples and the states in front of the threats of epidemics and situations which sometimes we cannot solve when we are divided. This is what we want to strengthen in Guinea-Bissau. We're facing the same challenges, and there is no country here which does not have a comparative advantages that could contribute to the strengthening of the national health systems. So Dakar must be a starting point for the new life of the national health systems in essential medicines production and vaccine production to guarantee health sovereignty. Thank you for your kind attention.
Merci beaucoup, Excellence.
Thank you very much, His Excellency, for this message of unity, solidarity, and research and experience sharing. Thank you very much for this strong message. I would now like to ask Dr. Amadou Lamine Samate to take the floor for his remarks.
Thank you very much again, Mr. Moderator. And I equally thank my colleagues who spoke before me. Of course, the problems of Africa are similar. I said it earlier in the interview outside. When you go to a village in Guinea-Bissau, in Senegal, in Gambia, in Nigeria, or even our towns, they are similar. If you don't put the name of the country, it could go for any country. If you see my grandmother in the village with her blouse and wrapper, it could go for any grandmother in any part of Africa. And equally speaking, if you go to the developed countries, the cities are similar. If you are in one country in Europe, one country in America, and you are in this city, are they not the same? They look alike to me. So by extension, our problems are similar, our challenges are similar, and in a lot of areas, our solutions are also similar. When it comes to local manufacturing, the statistics has been presented, and we saw, they say, up to 99% of the vaccines used in Africa are imported, and 95% of medicines and so on. Now, it puzzles me, and I'm sure it does the same to all of you. Why are we in this situation in Africa today? What happened? I think we all analyze it. What went wrong? When did it go wrong? Where did it go wrong? But here we are. We cannot continue to cry over spilled milk that is gone. But fortunately, we have the opportunity to make a difference. I think that is a big privilege for all of us to put our heads together, our hands together to make a difference. If not, when we also leave, the younger generation will come and say, what went wrong? What did Dr. Samate and the people who were ministers and those of us who are other administrators, why didn't we fix the problem? So here the problems are, and we need to fix them. As health minister, Alhamdulillah, for a little over 6.5 years now, my biggest problem throughout this period has been ensuring the availability of medicines and medical consumables to the people of the country. It has been my nightmare. and still my nightmare. We are still trying to work around it. Getting them on time, because most of them are manufactured, if not almost 100%, are manufactured from outside. Now, we advertise, the people participate, business people come on board, they say they can supply, they go and try to bring them in, they come late, sometimes problems, they tell you about shipping, they tell you about all kinds of problems. At the end of the day, the people of the countries are suffering. And apart from that, we are poor countries. People keep on saying Africa is rich. Yes, we are potentially rich, but the wealth has to be extracted for the people of Africa to feel the wealth. I think that is the bottom line. Yes, we are potentially rich, but it has to be extracted for us to be able to provide the services, to do the infrastructural development, and so on and so forth. So most of us are poor countries, and we end up buying the tablet of paracetamol more expensively than the rich countries because it's manufactured in their countries. The businessmen buy, transport it, put exorbitant profit, and come and sell to the African governments. This is a big problem. We are poorer, we spend more CT scanners if we want to buy, and so on and so forth. So this is the challenge, and we need to look at it. So manufacturing in Africa is the way forward because thereby it can ensure availability, timely delivery, because to many parts of Africa, we don't need ships. We can use road transportation. Within a week, commodities could get to one country. You see, that will save months so that when there are challenges, we can move things. But apart from that, it will also have an impact, a positive impact on the price of commodities. But I think at this juncture, it's very important for us to also emphasize on quality and efficiency when we talk about local manufacturing. In Africa, we should do away with mediocrity and ensure that whatever we touch is the best in the world. I think that way we will get the respect that we deserve, and then we can get the products that will be good for our people, not because they are made in Africa, they'll be substandard. Products that are good for our countries, our people, and eventually those products, probably other developing countries as well, could even the developed countries could buy them from Africa. So we should support the already existing local manufacturing entities that are here. We are very optimistic that from 2026, from the information we got, we expect an uptick in local manufacturing in Africa. I think that is a big plus. And we sincerely thank the Africa CDC and the heads of state for spearheading this process because it's the way to go. And it is possible because let's look inwards. Even if every one of the 54 African countries contributes a little, we can get state-of-the-art manufacturing plants in one country, 54 African countries, each of us contributes. Even if we do not do that, even if we mobilize people, business people, gives them the incentives, ensure that there's level playing field. Typically, we believe we have business people who could put in place good structures for manufacturing. In addition to that, but the market has to be there. Too often than not, even with regards to other things are manufactured in Africa, and we leave the African products and we go and buy products manufactured elsewhere. We should develop that sense of pride in what is made in Africa. But of course, what is made in Africa should be good enough. That's why I emphasize on quality products from Africa. So these are some of the very important things in local manufacturing. And it is also very important that we get the commitment. And we can only get the commitment if we increase what we put on the table to buy. Why are we worried about manufacturers manufacturing and them not getting the market? It's because our own contribution to the procurement process is less. If we contribute more, that means we'll have a better say. I mean, if we take the money from Gambia, and this is what our contribution, and we say we want to buy from Senegal, I don't think anybody will stop us from doing that. But if we ask someone to support, then the negotiations start. But we are happy many of our important partners now in line with vaccine procurement, Gavi is very flexible, and we thank the leadership, the new leadership for their flexibility. And I think Gavi, UNICEF, and other partners will listen to us when we say, let's buy high quality vaccines from our counterparts in Africa. Coming to health financing, domestic financing. You know, when I became minister, I met with the president and I looked around the health sector. I say, oh my goodness, all this work, what we inherited was really something else. Poor infrastructure, lack of life-saving equipment, and so on and so forth. I said to him, Your Excellency, I think from what I have seen, probably let's stop doing what we are doing in the other sectors. Let's focus on the health sector. Then let's fix these problems. And then you can now have time to work on the other sectors. Well, leaders, they have wisdom. He smiled and said to me, yeah, thank you, Honorable Minister. But the challenge is, if we build you new health centers, and we buy brand new equipment, the equipment will need electricity to function. And those areas don't have electricity. And your ambulances will need roads to run on. So, and your taps will need water in the health facilities. So in summary, he was telling me in development, we cannot just say health, even though I'm health minister, I keep on pushing for health. But a lot of other things have to go together. So that is why in Gambia, local budgetary allocation has been increasing. The percentage per se might not increase because other areas like road infrastructure is increasing. So if you look at the percentage, it might not change much, but the total volume has increased dramatically. And I think that is good. I also encourage, and I thank my colleagues who spoke about health insurance and the like. Gambia started the National Health Insurance Scheme, which we are rolling out now. And then one of the indicators for payments to the facilities is immunization. So they immunize, the more children they immunize, the more they get paid and the more they can invest in immunization services. The sin tax, my colleague from Sierra Leone also mentioned, there is a tobacco tax, and then that typically is meant for the health sector, even though as it goes into the national pool, it becomes very difficult to get from Ministry of Finance. Our Ministry of Finance team is here. I'm sure they are listening to us, but there is progress in trying to get it for the health sector. Coordination, partnerships. You see, Africa, I think each country here, seated here, we all have business people. Each country has some rich people. Let us make them understand, engage them. Let's engage the businesses because we assume they know immunization is important. Maybe some of them don't know to the extent that we know. So we need to engage them so that they can also contribute. Corporate social responsibility is very important. And there are a lot of kind-hearted people. When we went to Brussels, Bill Gates was there, donated a lot of funds. Other people also did, other countries did. But Africa has some people, maybe when they are also approached and they are made to understand, they can donate. Maybe Gambia has a few, maybe Senegal has a few, maybe other countries have a few. So let's engage them and ensure that they also understand, because they certainly would only want to put their funds where the benefits will be reached. Of course, there are speakers coming after me. I wouldn't want to keep on going on, but I think what is also important is we also only talk about revenue. We don't look at the expenditure part. So they go in tandem. When you talk about revenue, you have to also talk about expenditure. So let's ensure that we have data that tells us where we are spending the funds, is it useful? So that we can prioritize and reprioritize. If resources are not many, you prioritize so that we can only have very impactful interventions. And finally, I urge my brother, Africa CDC, and the entire team. You see, many of our countries, we spend more on debt financing than on health. So one task I want to give Africa CDC DG kindly spearhead what I refer to debt cancellation for health, so that debts that are cancelled, everything comes to health. I'm sure people will listen to you. If you say cancel the debt of Gambia, so that whatever you cancel, everything goes just to the health sector, no roads, nothing else. And then for each of the countries. So that's your new assignment, Africa CDC. From my humble self, it's just a suggestion, but it is just for starting a debate. I thank you for your kind attention. Thank you.
Thank you very much, Minister, and thank you. Your call to the DGs very well heard, and we shall follow that on that. Now, let me invite Director Godwin Tandom for his remarks. Just Director, just reminding that time is now.
Yes, thank you very much. I'll be very concise. One that I want to mention is to strengthen our routine immunization across countries. Campaigns are expensive and we cannot continue to campaign forever. Then the other one is to improve surveillance. We have mentioned digitization here. Nigeria as a country has imported almost 300 to 500 million nets in 15 years, none produced in the country. We have consumed over 1.3 billion rapid diagnostic tests, none produced in the country. It still boils down to the same thing we are talking. And now when you look at these products, where they are coming from, they are not really produced by the Asians. They are produced by other nationalities, taking their companies to Asia to produce. Why are they not bringing them to Africa, knowing that the consumer will be Africa? The challenge is that the business environment. Have we created an environment that will encourage the producers to do it in Africa? The global WHO recommended rapid ACT in 2002. One of them was artemether-lumefantrine. It was only one company that was producing it, Novartis. For almost 5 years, no other country joined. Of course, once there's a product that is new, like now they are recommending dual AI nets, which Africa does not have the technology. And we must know that there's the producer will guide their patency rights, which they don't want to disclose. Of course, for African countries to be able to convince them to come, we must create an environment that will show that when they are produced in Africa, there won't be any government restriction or other issues that will make them and not to continue to do business. Then also we must think of providing a balanced share. We are talking about producing in Africa. It is possible for countries, we cannot make it like Nigeria now. We've already gotten 3 rapid test manufacturers. We have had the 2 major companies producing nets coming to establish in Nigeria. Again, it is possible for us to provide other countries within the region opportunities with support from African CDC that, yes, let everything not be concentrated in one point, so that when this country has this strength, they can as well relate with the other countries for products. Then another major challenge is the WHO pre-qualification. It is expensive. Most local companies will not be able to raise enough resources to get WHO qualification. But we know that some of these products that are produced in the country, they are as good as the one that WHO has licensed, WHO pre-qualified. So is it possible to have a new standard, which is like following the Honorable Minister of Gambia, not lowering the quality, but lowering the resource, the money required to achieve this qualification. Then, lastly, I think those are the points. Because of time, let me not go further. Thank you very much. Yeah. Thank you, sir.
Good, Director. Now, we are coming to our last speaker, who is His Excellency Dr. Ibrahim Sy, the Minister of Health and Public Hygiene of Senegal. You have the floor.
Je sais qu'on n'a pas beaucoup de temps.
I know that we don't have much time ahead,
Sur ces deux questions qui ont été
but
posées,
on these two questions that were tabled, I will try to give some inputs. The first thing for me is that in the sub-region, we must have a shared and common vision around our priority needs. Today, we're talking about vaccine production. We must know the list of vaccines we need, how to prioritize them, and afterwards see how we can organize the prioritized needs around a certain number of production hubs, and these hubs will be backed by centers of excellence in matters of research and development, because for me, sustainability entails that we develop ourselves, have our own research that will feed vaccine production through these hubs and make these hubs work in complementarity. We must tend to have the same production units everywhere. So they must specialize based on the priority needs that have been identified by all the countries in the sub-region. But for that, there is need to organize the ecosystems and lift the hurdles to the vaccine of production. And these hurdles, according to me, and from my experience discussing with all the manufacturers of medical products, is access to land. How can we have a secured access to land? How can we revisit the tax system? How can we get access to financing, even if it is private financing or financing from banks that are interested in the product of such commodities? How to access technology, because generally we have negotiations. This is about negotiations. There are technologies developed elsewhere that we don't have. Shouldn't we build partnerships and or have agreements for technology transfer? There is the issue of market and competitiveness. Will the vaccine that we will produce in our sub-region be competitive in front of some great tycoons who can produce much and flood over the market, preventing Africa to sell its production? And the last barrier is energy. And this comes to what my colleague from the Gambia is saying today. The development of the health sector must be pegged to the development of the other sectors that underpin sustainable development: road infrastructure, water supply, energy, electricity. So these are key to supporting the sustainability of the health sector, and this involves the engagement of many other line ministries working together and in collaboration with the Ministry of Health. In Senegal, we have understood that, and we have an approach now that will mainstream health in all the sectors. Now, on the last bullet item for me today, and regarding the funding of immunization, what is at stake is to mobilize the new stakeholders in the funding of immunization. We have the state, we have our technical, traditional technical and financial partners, but today we must have other levels to raise funds. We're talking about domestic fundings. I am used to meeting companies. Each company tells me that I have funding to do, in fact, societal corporate responsibility. So all these different social responsibilities can be grouped in a national social corporate responsibility fund. We have innovative funding. Today, we have, for example, e-transfers, tax on e-transfers, on tobacco, and others can be innovative sources of funding. There is also the idea of co-funding through the summer insurance schemes. So to do that, we must see the percentage of the insurance which we can pay to the funding of immunization, and this will enable the population, which is the vast major beneficiary of this financing, to contribute, because up to now immunization is always almost free of charge in our countries, and a small contribution of these beneficiaries through that insurance wouldn't be bad. So these are a few inputs which I would like to add to what my colleagues, ministers said, and other representatives in this forum. Thank you.
Merci beaucoup, Excellence, pour
Thank
ces très
you,
bons points qui vont
Excellency,
certainement
for these
enrichir
very valid
les communiqués finaux.
items that will
Peut-être
enrich
juste pour
the final
résumer
communique.
brièvement que
Just to
dans
summarize,
les deux cas, je pense, les
in
intervenants ont
both
insisté sur
cases,
l'importance du
the speakers
leadership
insisted
au très
on
très
the
haut niveau.
importance
Et ça, c'est capital,
of
que ce soit pour le
the
financement,
leadership
pour
at the highest
la
level.
production
This
locale,
is
il faut qu'il
key
y ait un
both
engagement vraiment de
for
tous les chefs
financing
d'État.
and local production.
Et
There
sur le
should be
financement,
commitment
en
of our
particulier,
heads of
il est
states.
ressorti
And on
clairement des intervenants
financing,
que
it came
on a
out
besoin
from
de
the
regarder deux
speakers
choses. Donc, la
that we
première chose, c'est
must
d'abord d'augmenter
look
les
at two things. The
financements.
first thing is
Et pour augmenter les
increasing
financements, il y
the
a
financing,
plusieurs
and to increase
expériences
financing.
qu'on a entendues,
We have heard
qu'on a entendues ici,
several
qu'on peut
experiences
regarder
here
aux ressources
which we can
domestiques, mais ce n'est
learn
pas
from.
suffisant. On
That
doit aller
is
au-delà,
domestic resources, but this is not
regarder
enough.
au
We
financement
should go
innovant. Vous
beyond
avez entendu les différentes
consider
taxes qu'ils ont
innovative
mentionnées ici.
financing.
Regarder
We
au financement,
reviews
regarder
have the various
d'autres
taxes
acteurs.
that were
Je pense
mentioned
sincèrement
here.
aussi que dans le pays,
Co-financing
il y a
as a
certainement d'autres
stakeholders.
acteurs qui
It
peuvent
is
aussi contribuer
certain there are
à mobiliser plus de
certainly
ressources.
in our countries other
Et le dernier point qui est important, c'est
stakeholders that
aussi par rapport avec
can
l'efficience.
help
Il
mobilize
faut regarder comment est-ce qu'on
further
utilise
or
l'argent.
additional
Donc,
financing.
il y
The
a
other
l'efficience
aspect
de
relate to
on
efficiency,
alloue cet
how
argent
to
à quoi.
use the
Ça, c'est la
money,
première
to
chose.
what do we
Et la
allocate the
deuxième chose,
money.
c'est
This
aussi
is the
on
first
dépense
thing.
cet argent à quoi.
And
Et il y a un
secondly,
point encore extrêmement
to
important
on what
qui
do we
est
spend the
ressortissant, c'est
money.
sur
And
les
one
stratégies
important
qu'on
point
utilise
came,
dans la
it
mise
is
en
really the
œuvre de nos programmes
strategy
qui
that we
doivent
use in
aussi
the
être des
implementation
stratégies
of our
d'efficience.
program
Par
that
exemple,
must be
en renforçant la
efficiency-based
vaccination de routine,
strategies.
je
For
crois qu'en
example,
termes de coûts,
strengthening
on a depuis beaucoup moins
routine
cher en attendant
immunization. We
avec la
have
pandémie pour
lower costs
lutter avec les
than
épidémies.
to wait
Les
until we
gouvernements
have
ont aussi des
outbreaks and
stratégies qui
respond.
permettent
Digitalization, all these
de travailler.
are strategies that
Finalement,
will
sur
make
la
us
question
more efficient
de
in
la
our work
production
on the
locale,
issue of local
on ne
production.
pourra pas insister suffisamment sur
We will not
l'engagement politique dont on a parlé,
insist
mais peut-être un point important, c'est
much
que
enough on
le besoin de
political
créer un
commitment, but
écosystème
there is
favorable
also the
à la
need
production locale.
to
Je pense que ça,
create
c'est un
a
message fort
conducive
qui est extrêmement important,
ecosystem
qu'on
to
doit regarder
local
l'environnement.
production. This is a
Si on
strong
peut
message
donner le wave,
that
tous on a
we
entendu,
must
on
see.
doit
We
regarder la
must look at the
régulation, on doit
environment. We
regarder
must
le
revisit
marché
regulation,
qui va
the
stimuler les
market
ressources.
that
Mais
will
au-delà de
promote
ça,
that.
il y a même d'autres
And
éléments
beyond that, there
importants
are
dans cette
other
transformation, c'est
important
l'énergie
elements of
et
that
la digitalisation. De plus
environment,
autres
energy,
éléments pour
digitalization,
faciliter cette
that are
agenda de
all
production locale.
important to
Donc
facilitate
voilà,
this
c'est des points que je
agenda
crois
of
que
local
nous
production
espérons
and
que
manufacturing.
notre
These are
secrétariat a bien
additional
saisi
points which
pour
we hope
enrichir
our secretariat
les
has
communiqués
taken
et
good
va
note of
organiser.
to enrich
Donc, je
the
dirais peut-être
final
pour finaliser
communique. So on this note, I would like to invite the DG to see whether he has some comments to make on otherwise. Well, you are the one managing the country.
I don't know if I have to switch in English for my colleagues. No, vous savez,
La traduction.
You know,
okay.
you know,
Les ministres nous ont interpellés sur un certain nombre de
the
choses.
ministers interpellated us on a certain number of things,
Scientifique.
but this is also a scientific
Quand
dialogue.
nous discutons avec nos
When we
collègues, je vais
discuss with
commencer
our
par
colleagues,
un des
I am going
piliers
to
de
start
financement innovant, les debt
with
swaps.
one of the
Comment
pillars of innovative
en français.
financing debt swaps,
Je vais vous donner ce qui
the
s'est
debt
passé à
swaps.
Berlin.
Let me tell you what happened in Berlin.
Miss,
In
I don't know if
concrete
you are following
terms,
what I'm saying in French. Maybe I will
je
speak
ne-
in English for you to be well understood. When I was in Berlin, I challenged the German government to provide $1 billion to Global Fund. I started to challenge them a few times ago. Then the day before this event, I said, if you give 1 billion, I will give to the minister a public big hug. And we started to negotiate. They said, okay, we have $900 million. I said, it's not 1 billion. Do you know what they did? They took $100 million as debt swap that they added in this amount to make it $1 billion. And I made a clear decision. I don't want to give the name today, but I'm recruiting now as an advisor, one of the I think I don't know if there are 4 or 5, but is very well respected in terms of debt swap. He's not African. He's becoming our advisor for the debt swap issue. That person will help to unlock the door because this aspect of debt swap is becoming another way to get funds for the health sector. As you said, it would not be for other sectors, it will be for the health sector. I agree with you. And we need to frame it on the way that donor countries, and as we understand this money will be for the health sector. But if you see, if we consider the way we are using funds in the health sector, the first area is out of pocket. Out of pocket, in some countries, even in this region, it's more than 60%, even 70%. You know that. The second one is external resources, and then the third one is domestic resources. How can we make sure that our countries, our people are not becoming poor with this out of pocket? It's just the community health insurance. We saw it in Rwanda. In Rwanda, people are paying less than $2, but they have access to all kinds of services. It's something we can do in Africa. Minister, you started that in Gambia, in Senegal. You know, in each country, we have some pilots, but it's just for us to scale up that at country level. There will not be a specific model for all countries. You have to follow your own path. But we say, if we don't put in place this community health insurance scheme, the out-of-pocket will kill us. Then when you resolve the out-of-pocket issue, we said here, people are crying every day. We want ODA to be back. We are not saying we want ODA to be back. We say we need another kind of partnership that will respect us. If this ODA, we are just receiving 20%. You can imagine 20% out of 100% they were claiming to give us. If we can just capture this 20% now, this 30%, even the US, they're saying this 40%, it will make some changes if it's on. This is why we are saying we need an integrated plan to be developed. There is no other way for you to ensure that you will implement your vision if you don't have this integrated and well-costed plan. Not done in an office, but a bottom-up, starting from, a health center or health area, and at national level, you just consolidate everything. We believe this is the way to move forward, because when I start to see the trend from donors, global donors, each of them want now to impress with a specific plan. That one is also the fragmentation we don't want to see. These are the two main drivers that you have. If you see your budget, human resources, do you know the average of what we call the ghost staff? Almost around 30% in Africa, depending on countries. There are countries where the digital system is in place, we don't really have them. But in most of our countries, this is the reality. It means we need to cut that, we are saving 30% of money. The second one, if we have this pool procurement mechanism, each of you, Gambia, you want to procure commodities, but your population is small. Nigeria, they have 200 million people. But if we put things together, if we say, let us procure together, a pool procurement, we are saving more than 35% of your money. You save money with staffing, you save. I'm so positive, ministers, in terms of financing, that we can achieve something. But that one will request strong political will. It will request, involvement of our leaders. We have opportunity to discuss with some of them, and will create, I think in February 2026, it will be the main topic for the AU Assembly. Regarding the local manufacturing, you are right. Local manufacturing is mostly political will. Let us be honest, ministre, pour le Sénégal, par exemple. Les autres ne se laisseront pas faire. Ceux qui fabriquent les
if you have that will, the manufacturers, the other manufacturers from abroad, from the West, will not, stand crossed arms. I will not mention that country. There is one country which manufactured their vaccine, go and purchase from another country. So that industry, that firm was killed, whereas, so today you have a major decision to take debt on IPD with the various banks. You must pay back with interest. But now, if you manufacture just vaccines for Senegal, you will not be refunded. But if you manufacture vaccine for all the continent, you will have bigger volumes, lower prices, and there will be greater predictability. Visibility in French, predictability. You will have that, and you will see that IPD, that Buffett, to make the difference with what we are producing and what others produce, so that our industries, our manufacturers do not produce at a loss. I'm a fan of Gavi, of Gabilib. So because there are a certain number of Gabilib, so because there are a certain number of mechanisms that enable us to make progress, we are in favor of global fund following that model. Others également partners to share that model.
And we'll talk about it. Thank you.
Voilà, merci beaucoup DG. Donc nous arrivons donc à la fin de cette partie du programme. Nous allons applaudir pour nos intervenants, pour ces belles interventions.
Thank you very much, DG. We are now at the end of this panel, and this was a wonderful conversation which will allow us to have better quality interventions. This is what we wanted. We wanted to hear their opinions, hear different perspectives, and learn from one and all's experiences. So we need to remind ourselves of African solidarity, and this is how we can meet our expected results. I would now like to ask for the last presentation of the day, reading of the communiqué. Professor Tandara, if you could read the communiqué, and then we will give the floor to the ministers so that they can react on the communiqué before proceeding with the closing ceremony.
Merci beaucoup, Dr. Ngashi.
Thank you very much, Dr. Ngashi, for giving me the floor once more. I am now facing the heavy burden of reading the communiqué with you all.
On l'appelle communiqué de Dakar.
We entitled it the Dakar Communique on the high-level commitment to immunization and primary health care transformation.
Le 19 octobre 2025. Il y a un préambule qui parle.
There is a preamble which reads as we, the Ministries of Health and Finance of the member states of West Africa, gathered in Dakar, Senegal, from October 17th to 19th, 2025, for the high-level regional forum on sustainable financing for vaccination in West Africa.
J'attends qu'on mette le texte.
I am expecting, or rather waiting for the text to be projected on screen.
En présence de représentants de la Commission de
In
l'Union
the
africaine,
presence of representatives of the African Union Commission, of the Africa Control for
des partenaires de l'Alliance pour la
the African Center for Disease Control, our partners such as Gavi,
du secteur privé,
the Vaccine Alliance, partners, research institutions, the private sector, civil society, and communities,
la déclaration d'Abuja,
considering the Abuja Declaration, which commits states to allocate at least 15% of their national budgets to public health,
la déclaration
considering the Addis Ababa Declaration on Immunization, which calls for immunization to be made a political priority at the highest level, considering the Abidjan Declaration, increased mobilization of domestic resources